Athena, can you hear me?
Yes, we can.
We need to text the phone number for the board call-in to Florence Jameson and Marie Kerr, please.
It's happening right now. Being sent by email.
Can you text it to them? Is that possible?
Will do.
This is Florence Jameson.
Thank you, Florence. This is CJ Bowden.
Hi, CJ. Good morning.
Good morning. We will be getting started here in just a few minutes.
Wonderful. I'm just putting you on mute until you do roll call.
Has Marie been able to call in yet? Do we have confirmation of Marie? Marie, are you on the phone? CJ or Damon, can you have the number texted to Barbara, please?
We'll do right now.
Marie's not on the phone yet.
Athena's sending it now.
We have Dr. Jameson on the phone,
Unless
and
Marie's on mute.
we do not have confirmation that Marie Kerr is on.
This is a great connection. This is the loudest and clearest I've ever heard it.
Florence, is that you talking, or is that Marie?
That's me, Florence. Yeah.
Marie, are you on the line yet?
Hi, this is Marie.
Marie, is that you?
That's correct. It's me.
Okay, great. Thank you very much. Okay, everyone, I'm going to call the meeting to order this morning. This is a properly noticed meeting for the Silver State Health Insurance Exchange, and we're televising this between the Carson City office and here in Henderson. If there are people on the phone, if I could ask you to please mute your phone unless you're speaking, that will help the sound system here. And I don't have any other announcements. Mr. Fisher, do you have any?
No, I do not have any announcements,
Okay.
Madam Chair.
Why don't we do a roll call and make sure we have a quorum?
Sure. Thank you, Madam Chair. Ms. Johnstone?
Here.
Ms. Lewis?
Here.
Dr. Jameson?
Here.
Ms. Kerr?
Here.
Dr. Ford?
Here.
Mr. Wilden? Here. Mr. Kipper?
Here.
Ms. Teska? Vice Chair Edkins?
Here.
Madam Chair Campbell?
Here.
We have a quorum, Madam Chair.
All right. Thank you, Mr. Fisher. I'm going to open it up for public comment, but before I do that, I just wanted to let people know that we were probably trying and end this meeting by about 11:30 or so. I want a very vigorous conversation among all the parties here today. but I know that we've only scheduled it for 2 hours. I'm going to say that probably we will extend it out a little bit longer so that we might, if we need that extra time, we're going to let the board have that time as they go through the options. So with that, Mr. Haycock, can you help me do a show of hands? How many people would like to testify up in Carson City?
Just one, Madam Chair.
Okay, thank you. And how about here in Henderson? How many people would wish to testify? 1, 2, 3. Looks like we've got 3. All right, why don't we start in Carson City then, and then I'll bring it down here to Henderson.
There we go. Good morning, Jim Mullen with Delta Dental Insurance Company. It was just about a year ago when I was traveling quite often up to Carson City for some of the advisory committee meetings and board meetings, and there was a final recommendation about the pediatric dental approach for the Nevada Health Link. We were very pleased with the outcome of the required purchase of dental for pediatric age children up to age 19. And we've been tremendously pleased with the structure of the exchange and the tremendous take-up of dental, not only for the pediatric age children, but for the adult Nevada's consumers who went through the exchange portal. And I think this is, if there's some successes to be recognized, this is certainly one of them for the Nevada Health Link. There was a Kaiser Health News article just released yesterday that mentioned in the country at large, the pediatric dental uptake is disappointingly low because HHS did not make it a required purchase. And it specifically mentioned the 3 states that took a different approach and how they should have been commended for taking that approach, Nevada among them, Kentucky and Washington being the other 2 states. So I wanted to speak with you briefly today because I've read the brief. I know that you have some serious issues with the vendor and with what is going on with Nevada Health Link. But the one recommendation that is, to my perspective, is a negative one is the purchase of the Connecticut, as they call it, Connecticut in a box, the Connecticut exchange that Deloitte has already is seeming to finalize a deal with Maryland, although it's not final yet. The Connecticut exchange in a box does not support standalone dental plans. So you will have, by the latest count, around 30,000 Nevada consumers, if you were to choose to take that route, who would have their dental coverage terminated by the standalone dental plan that they currently have purchased it from, and they would be redirected, presumably, to choosing from whatever embedded QHPs you have that offer the pediatric dental. That may cause a complete disruption in their continuity of care because those networks are not the same. So these individuals would go and find out they can't keep their dentist, they can't keep their plan, they can't keep a course of treatment that they've already started, and perhaps this is the first time they've had dental insurance in years. So I wanted to throw that caution to you as you can, consider your options and deliberate over these different considerations you have before you. I would say that not only on the basis of the Connecticut exchange not supporting standalone dental, it is serious enough of an issue in Maryland that the National Association of Dental Plans is prepared to file a preliminary injunction in Maryland on the basis that Maryland extended standalone dental plans the opportunity to offer pediatric dental. We have about 5,000 enrollees in that state, so we would be considered as someone who would suffer harm from that. Now, we have 22,000 Nevadan consumers from our affiliated companies. I'm not threatening that there would be a lawsuit. I have no idea what the National Association of Dental Plans might do, but they are certainly seriously challenging the Maryland decision to go with this Connecticut exchange in a box because it is not compliant with the Affordable Care Act. And CSIO is still having some reservations about the deal because Connecticut, I think the Maryland would have to pay $40 million for the Connecticut exchange in a box, and CSIO would probably be a large part of how that would get funded. And not comfortable with the fact that it doesn't fully support the Affordable Care Act with the allowance of standalone dental plans. So I'll stop there because I know you are cautious of your time, but I would like to reserve the chance to comment at the end of the meeting, if, depending on how the conversation goes. Thank you very much.
Thank you. Who do we have that wants to come forward here in Henderson? Okay, if you come forward, we need to have you turn on the mic. Make sure it turns green. You have to press quite a little bit. Oh, we'll have somebody help you. Before you testify, let me just also put on the record that we've got some public comment that's been posted on our website. There are 8 comments, one from Carpe Diem Strategic Services, Deborah Talbot. The Xerox Board update is on public comment. The Nevada Advocates for Planned Parenthood affiliates, one from Shelley Rogers, one from Susan Falcone, another from NAHP, which is the Association for Health Plans, and also from Patrick Casal. So those are already posted on our website. If you would, please identify yourself for the record.
My name is Carol Bose.
Okay. And Ms. Bose, you have 3 minutes to make your comments, please.
Oh,
Yeah, sorry.
I'm just here because I can't get insurance for my grandson. We've been trying since December 19th to get insurance, and we can't. HealthLink tells us that he's covered, and I called the insurance that says they told me he's covered, and he's not. Go back to HealthLink on numerous times, and they said, well, just sign him up with different emails. You can use many different emails. But I said the same, it should go by a social security number. They go, no, go by email. So we set them up with different emails. And then another time they told us to go to welfare. Welfare tells us to go to HealthLink. And then they tell me that there's 2,000 a day people applying at welfare. And that's why it's taking so long. And then the last time we did get a dental bill in the mail, and I tried to pay it online, and I couldn't. They said that once I can't change his password online because they said the system was down. So I can't get the health insurance for him. That's what we need. He's 6 years old. He needs health insurance since December 19th.
Could you please tell me when was the last time you tried to get into the system?
I think it was last week, and they told me the system was down and I can't change his password.
Okay.
And then I waited a couple of days and I called back and they said the system, you'll never be able to change his password is what they said. So I can't pay the bill online. So I mailed it, but it was $14 on it, and I paid the bill at the post office with a certified to make sure that he, that they received it by May 15th.
Okay.
But I just need insurance for him. I don't know why it's so hard. I don't know why welfare tells me to go to HealthLink. HealthLink tells me to go to welfare.
Will you be here the whole meeting today, or are you just going to stay to testify?
No, I could stay.
All right. If I might, I would like to connect you with Mr. Roos over here.
Okay.
And see if we can hold you through a process and make sure that we get coverage for him.
Okay, I would appreciate it.
All right.
Since December 19th, we've been trying.
Madam Chair, Mary Woods is in the audience, the HHS PIO. She can help the lady. We can solve it today. It sounds like it's a Medicaid issue, so we can solve it today.
All right. Thank you,
Follow
Mr.
her out in the
Wilden.
lobby, and we'll take care of it.
Okay, thank you.
No, and maybe we can get it done. You won't have to wait for the whole meeting if you don't want to. All right.
Thank you.
Thank you for taking the time to be here today. Who would like to testify next?
Good morning. Can everyone hear me? For the record, my name is Jack Kim. I'm here representing the Nevada Association of Health Plans. We are the medical carriers that are on the exchange. We have representatives from... Can you hear me now? I guess I have to get much closer. I'll start over again. My name is Jack Kim. I'm here on behalf of the Nevada Association of Health Plans. We have provided a written letter regarding the agenda item 3, which is a decision on where to go with the exchange. We have members of our association, both in Carson City and Nevada, or in Henderson, at this meeting. So as we provide our letter to the board on option 3, On agenda item 3, we looked at the various options that are presented before the board. We wanted to go on record today and indicate our support for option 2B. The 2B, we believe, gives the exchange the best path to resolve the existing problems with the exchange and really resolve some of the issues on a going forward basis. Option 2B is the option that provides a state-based exchange with infrastructure of the federal model, and we believe that's at this point the only process that seems to be workable at this point. While we know there's still a number of options and questions that need to be addressed with option 2B and any of the other options, we think they're manageable, and the health plans are here to say that we'll work with you on trying to get these things resolved. It is really important that we make this really clear that we need a decision one way or another on where we're going. And, we have about 180 days to the next open enrollment, that unless there's some decisive decisions made, we're going to be in a position where when open enrollment arrives for 2015, we're going to be in the exact same place. And I don't think any of us want to be in that place again. So at this point, I'll turn over to Mr.
Good morning. Tom Zumtbel, CEO of the Nevada Health Co-op. Again, I'm very appreciative of the work of the board. It's been tough for everybody. I'm especially appreciative of the medical carriers that we work with. As a startup, if I had gone through this myself, my head would be absolutely spinning. It's spinning otherwise, but it would have not even been understandable that it could have been this difficult. And without the support of United and Anthem and St. Mary's, we would not have been able to kind of get through this process as well as we have. So we're very appreciative of that. Sadly, Xerox just is not getting any better. I think there's so much effort, and we really appreciate the effort of the local staff, but it is actually getting worse, which is really unbelievable that it could possibly be getting worse. But daily, we slide a little bit backwards instead of forward. So thinking that there's going to be a Xerox option that would be acceptable for the November open enrollment just does not seem feasible at this time. So we strongly support with the other carriers the supported system. We think it's the appropriate way to go. I think it's the best option for Nevadans, and we're excited about that, or pleased that that option is even on the table. Our counterpart in Oregon, the co-op, not our counterpart, but the Oregon has actually approved 2 co-ops, and we reached out to them because Oregon is pursuing the supported state model also. And it's going to be quite an undertaking for us to get there, but we realize that we'll be able to do the right things to interface with the exchange in this fashion. We're going to have to figure out how to, it wasn't in our business plan as far as money, so we're going to have to figure out how to come up with a little bit of money to figure it out, but we think by far it's the best option for the state and the best option for Nevadans. Thank you.
Thank you very much. We have someone else that wishes a public comment.
How about now? My name is Patrick Casal, and I want to thank you, the board. Ms. Campbell, you've been amazing. Thank you very much for the help for some very, very sick individuals. You know, it's interesting. I wasn't going to talk about the dental, but it's every client that I have run across that had standalone dental has had a problem with billing, getting bills for 4, 5, 6 months at a time, never got any information from the dental carrier, whether it's Delta or whoever. And so the success of the dental plan, they may have enrollment numbers, but the consumers don't have insurance. That's one of my biggest complaints. Her name is Sherry Janelli. You should talk to her. She's got a periodontal disease right now, along with other health issues that'll be compounded. So I found it very interesting to hear Delta possibly threaten to sue, maybe. That's crazy. They're not delivering the policies to the clients the way they should. That was really my main speech today. You know, in the last 3 weeks, I've been dealing with numerous problems, and every one of the problems were individuals who signed up directly without access to help or tried to do it without help. I would suggest a disclaimer saying that you should seek advice and how to pursue and how to buy health insurance, whether you use a navigator, an assister, a broker, whomever, because quite frankly, navigating a system as inept as this Xerox system has been for the last 7 months, I can't imagine a person who in a lower income bracket who doesn't have a lot of computer experience can manage to get through this and consistently get error after error after error. And we'll just say, the heck with it, I'm done. I have a young lady named Terry Uaney who basically told me that. I'm finished. when she got an email from Xerox saying, we have your problem fixed 2 months ago, and she's still not insured as of today. There should be no threats of lawsuits. There shouldn't be any lawyer intervention. These people should be insured. It's as simple as that. And this process was to protect the 15% of the uninsured Americans, and it's failing big. I suggest that you do something great for the consumers, and I definitely think we need to protect the consumers and ensure they get quality coverage at affordable rates. And that's it. Thank you very much.
Thank you very much. Anyone else here for public comment, if you'd like to come forward?
For the record, Lou Silla, I'm a broker here in Nevada. I actually wasn't going to get up and say anything, but after I heard the speech from the gentleman from Delta Dental, I have to be very candid with you and hope that the board is not influenced in any way by, I mean, to me, it was absolutely despicable to get up and say 27,000 people or whatever number he threw out are going to lose dental coverage if you decide to make what he felt is the wrong decision. B, that there could be a lawsuit, but I'm not really saying there is, but there might be. That alone would be the last day that he would have anything to do with a business that I own. And also, the very last phone call I got in my car before I walked in here was a customer who we signed up for Delta Dental in January, who still has not gotten any cards. I've called several times. He's called several times, and now he just told me, that he was told that they only do it online and you have to go online and print them off. And he said, well, I don't have a printer. So I said, well, why don't you stop at my desk and I'll do it for you. So the point is to make a public comment like that at a meeting like this is very, very inappropriate, and it's probably reflective in the way they run their whole business. That's all I have to say. Thank you.
Any other comment here in Henderson? And Mr. Haycock, take it back to Carson just to make sure someone hasn't changed their mind up there.
No other public comment up here, Madam Chair.
All right, thank you. We'll go ahead and close public comment now, and just know that we will have public comment again before we adjourn the meeting. The next item on the agenda is our discussion and possible action regarding options for improving the Silver State Health Insurance Exchange based on the Deloitte Assessment Report, staff recommendations, the Health Claim Auditor's Report, and other options for improving the exchange as may be identified by the board. Before we go to that item, I personally want to extend some thanks to some individuals that have helped us over the last week. I think as many of you know that the executive staff and myself went back to Washington, D.C. to meet with CMS. We were also joined by a member of DOI and a representative in Washington that represents the governor's office. Mr. Wilden was nice enough to join us by phone at that time. I want to thank Administrator Marilyn Tavner, Cynthia McDonald, Jen Stolback, and Jessica Kahn, who were the people that really helped move those meetings for us back in Washington, D.C. We probably had 35 participants from CMS and CSIO attending those meetings. Our meetings with that entire staff at CMS was very positive and very productive. And as we developed the option draft that you see here today, they continued to help us edit and refine it so that we were factually accurate on it. And they worked with us all through the weekend on that. And I can't begin to express my gratitude to them and to our staff for working so hard over the weekend. So before we get started, I just want to make sure everyone knows how much I appreciate it and how much the board appreciates it. So with that, I'm going to let Mr. Fisher get started and give us a little bit of background, and then we'll start discussing each one of the options.
Thank you, Madam Chair. For the record, Steve Fisher, Interim Director for the Silver State Health Insurance Exchange. And what I thought I would do, first of all, is I just wanted to thank staff for all of their hard work in putting this report together. As Madam Chair said, we put a lot of time and effort into this report. And just wanted to briefly touch on a couple of background points in the report. And then I would like to talk about the CMS meeting that was held last week, And then I will jump into the different options. And what I would like to do is go through each individual option one at a time, stop at that option, discuss it before we move on to the next option. I just want to make sure that the board has an opportunity to discuss it and understand it and make sure that, that they have a really good understanding of that option before we move forward. So with that little background, we went live, State Health Insurance Exchange went live on October 1st. As mandated by the ACA, individuals and families and employers began utilizing the web portal and call center. Initial issues surfaced with the exchange and created barriers to enrollment and continued operations. We have faced many barriers, and we continue to face barriers with the current online system. On March 6th, the board approved the contract for Deloitte Consulting to perform an assessment of the Xerox BOSS system. Not only did they look at the Xerox BOSS system, but they looked at the call center. They looked at the exchange operation as well. The purpose of the assessment was to assess the current state of exchange functionality, supporting processes, technology, so on and so forth. Deloitte presented on April 10th their findings, and those findings, there were 3 go-forward primary options, which we'll be discussing today with some additional sub-options included. Due to reports of continued issues with effectuating enrollment and processing individual premiums, on March 27th, the board decided to basically remove the individual billing from Xerox and place that onto the carriers. That process is moving forward as we speak. On April 17th, Bob Carr and Associates, the contractor hired to perform a BOSS audit for the period of October 1 through February 28th. They presented their service level agreement audit report to the board on April 17th. And on May 8th, the board directed staff to develop this report that we're going to be going through today. CMS, last Thursday, as Madam Chair has already stated, we spent the day with CMS, and I do have to say that the consistent message from CMS and from Administrator Tavener was a message of support in whatever decision the board decides to make today. CMS did discuss an option called, I'm going to call it supported state-based marketplace. It was something that, I was somewhat familiar with regards to Oregon. Oregon had made a decision to go down this path. I wasn't exactly sure how that worked, but when we spent the day with CMS, they explained it to us. And so I just wanted to explain to the board what the supporting state-based marketplace means. Essentially what that means is you're still designated as a state-based market. You don't lose that designation. You're still considered state-based market. However, CMS will provide the eligibility and the enrollment piece for both the individual and the BOSS. They will also provide the website and the call center functionality. A state will still be required to have an entry point for Medicaid and CHIP, though, however. We must be able to take phone calls, and Medicaid must be able to take consumer calls over the phone and be able to help those consumers apply through an electronic application process for Medicaid, and as well as take paper applications. So this is a little bit, it's still, like I stated, a state-based marketplace. It is not a federally marketplace. A federally facilitated marketplace is where the feds have all control of the marketplace. So to summarize the CMS visit, CMS is willing to support Nevada as a supported state-based marketplace with an opportunity to utilize the federal eligibility enrollment system for plan year 2015 or beyond. This can allow Nevada the opportunity to make an informed and thoughtful decision regarding the future of the exchange. The process where applicable will be discussed in options below. The process to utilize this particular option would require substantial work on the Medicaid side. Currently today, electronic information is from the boss to Medicaid. If we were to go down this particular path, then Medicaid would have to then move that connection to the federal exchange so that that information can be passed back and forth between the federal system and Medicaid. So there is some work there on the Medicaid side. I do want to point out that that work or the services provided there, the cost would be a 90-10 split, 10% state funds, 90% federal funds in order to fund something like that. Staff, the options that staff used to put this report together, we reviewed the Deloitte assessment. We reviewed the health claim auditor's report. We consulted with other states in similar situations. We reached out to Maryland, we reached out to Oregon, Massachusetts, Florida. We conducted meetings with staff of the Division of Insurance, Division of Welfare, EATS, Enterprise Information Technology, and the Governor's Office. We traveled to Washington, D.C. as previously discussed. So now I'd like to jump into option number one. Option number one is remediate Xerox and continue with its system. So status quo, stay the course with the current system. Xerox would continue to utilize its BOSS platform as well as maintain the customer contact center. The individual marketplace would follow the current policies and procedures. The shop marketplace would continue to be supported. Plan certification would remain with the Division of Insurance. Stay the course. Under option one, we have two sub-options, option 1A and option 2A. So option 1A is remediate the current system by November 15th of 2014 and provide project management oversight of the Xerox contract or the Xerox team to ensure that that date is met. This is similar to what Minnesota has done. Minnesota has hired Deloitte Consulting to come in and perform project oversight of their system at a cost of approximately $5 million. So that is the description of this particular option. Stay the course, bring in a third-party vendor to oversee the project management of Xerox between now and November 15th. When speaking with CMS about this particular option, it was very clear and essentially a requirement that we have a contingency plan. The contingency plan that was put forth by CMS was to set up a set of milestones with Xerox, a remediation plan between now and November 15th. At those, well, to be honest, by June 30th, which is coming up pretty quickly, if certain milestones are not met, June 30th happens to be kind of a go or no-go date by which the feds would have enough time and we, welfare, would have enough time to make the shift over to the supported state-based marketplace. So June 30th is kind of a date, a checkpoint, if you will. If certain milestones are not met by June 30th, then the state could then make the decision to move to a supported state-based marketplace for the November 15th open enrollment period. And if that were to occur, we could also make the decision at that point to give the Xerox an opportunity to take the next year to fix the system. Feasibility, the exchange could move forward quickly on this particular option. Xerox is currently under contract, and the funds needed to acquire the third-party project management office, they're available. Should the board wish to pursue this option, we could put out a streamlined RFP request for those vendors who could come in and provide that project management oversight. However, there is no guarantee for the third-party project management performance of our current vendor. The cost of this particular option, we have, because of our low open enrollment numbers, we do have an additional $10 million that will not be expended in the budget that could be redirected for the use for going out and hiring a project management office vendor and perform those duties. The cost for that would range from $5 to $10 million and would cover a period from 6 to 12 months. And with that, I would like to open it up for any questions that the board might have on this particular option.
Before I open it up for discussion on that, I want the board to know we have Xerox here today. They have done what I would call an expedited plan that falls in line with this option number 1. And as soon as we get done going through the detail of both option 1A and 1B, I'm going to ask them to come up and present their plan so that we have all the information that we need on this option. So I'm going to go back to you, Mr. Fisher, again, and open it up for discussion with option number 1A.
Madam Chair, this is Leslie Johnstone. A couple of questions. In the discussions with CMS, did they talk at all about what types of items might be on their June 30th milestone list? I'm wondering if those might be things we've been trying to accomplish anyway.
Thank you for the question, Ms. Johnstone. No, they did not specifically talk about items that would appear on that particular plan.
And then my next question also kind of targets on that June 30th date. Even with an expedited RFP process for the project management, what would be the soonest that we could have somebody on board to help us with that process? And is there any possibility, because Deloitte has already done so much of the work to get familiar with our project, that they would be able to serve that role?
Once again, thank you for the question, Ms. Johnstone. We could pursue working with the Division of Purchasing to take a look at bringing on Deloitte Consulting. We currently have a contract with Deloitte for the investment. We could maybe take a look at that and see what possibilities there are to bring them on as a PMO. Another option might be we have a contract with PCG. I mean, that's a contract that we have with the state. They may have resources that provide that particular expertise. That's another possible option. But going out to RFP, Sean, short one? Sean is shaking her head. Yes, we could do a short RFP for the PMO. I'm not sure what short means exactly, if it's a 3-week or a short turnaround, yes.
Mr. Fisher? Lynn Atkin. So in option 1, we have to hire an outside party to manage Xerox. Is that part of 1A?
Thank you for the question, Ms. Atkins. We don't have to hire an outside vendor. The recommendation would be, if you were to choose to go down this path, we would recommend that we hire a third party to come in and manage the project.
Dr. Jameson here.
Who's speaking?
Dr. Jameson, Chairman.
Okay, and could
Yes,
you
I just-
speak up? Can you speak up a little bit louder? We can barely hear you.
Yes, I just wanted to echo the comments that Johnstone had made regarding if this was something that was selected that as project manager, that Deloitte, after they have so long walked this journey with us and done such an excellent reporting evaluation, that I could just wanted to say that if they were eligible for an RFP, to be involved in the RFP process, because they also, I think, would be the ideal people.
All right, thank you for your comments. Mr. Wilden?
Thank you, Madam Chair. Mr. Fisher, I just want to make sure you sort of kind of glossed over a little bit. The June 30 deadline, I just want to make sure in my mind, so the feds are requiring that we have a contingency. There's several gates you've got to go through by the June 30th, or they're not requiring a contingency. You've got to have a detailed threshold of performance, and you have to have a detailed schedule, and you've got to have some confidence by June 30th that roll out over the next 4 or 5 months, or you got to flop to the federal exchange or state-based federal exchange. Is that my understanding? Is that if the Fed with a detailed deliverables that we have confidence in, then our window expires June 30th.
Thank you for the question, Mr. Wilden. Yes, June 30th is a date by which if a decision is made, for example, to continue to go forward with Xerox, then we would have lost the opportunity to go to the federal exchange after June 30th, because June 30th is that kind of that cutoff date. The feds are not comfortable after June 30th with the time frame to be able to. There's not enough time necessary to get all of the necessary work done to make the change to the federal exchange if we start after June 30th.
I'm sure may I follow up. So again, in my mind, this is do we believe we can have a detailed threshold of performance and the scheduled deliverables and have confidence? So again, I just want to make sure, to me, the threshold discussion here is we have to have that detailed schedule. We have to be confident that we're going to be able to deliver, Xerox is going to be able to deliver all the things they need to deliver, or again, we're losing another window to change direction by June 30th.
Yes, Mr. Wilden, that is correct.
You know, and just looking at the calendar, that's 40 days. Yeah. Ms. Johnstone?
Leslie Johnstone. So just to clarify, that's the window to go to a federal marketplace or the state-supported marketplace, federal marketplace.
Yes, thank you for the question, Ms. Johnstone. Yes, the answer to your question is yes.
Do we have any other questions? Any from Carson City? Mr. Kipper?
No comments on this point, Madam Chair. I think this has been very well discussed, and I'm anxious to hear the rest of the options.
Okay. Ms. Kerr, any questions from you?
No questions, thank you.
Thank you. And Ms. Johnstone?
I'm sorry, one more question. I know that the other state agencies have loaned us a lot of resources, including Mr. Fisher. Is the assumption that the state doesn't have the internal resources that could dedicate a project manager to this project to get us at least to June 30th or until a project manager is selected? So would we be on our own until we get a project management company contracted?
Thank you for the question, Ms. Johnstone. Yes, the state has provided, or I should say other agencies have provided some expertise to the exchange, one of which is a project manager, excuse me. We do have an open position for the project management position within the exchange. We do have a recruitment out. To answer your question, yes, we would be on our own as the exchange to manage going forward until such time we were able to hire the expertise that we're talking about.
Okay, let's move on to option 1B then.
Option 1B, thank you, Madam Chair. Option 1B is similar to 1A. However, this would be to go to the supported state-based exchange immediately for the upcoming open enrollment period and give Xerox a year and a half, I guess if we were to start today, a year and a half to remediate the Nevada Health Link, the current system. The feasibility of this option, it correlates very closely to option 1A. There's already current contracts in place. We would, excuse me, we would still go out for a project management office vendor to come in and oversee that project. However, there would be a substantial work on the Medicaid side to get us from where we are today to where we need to be for the next open enrollment period, the connections, as I spoke to before, to the federal exchange. The cost, similar to option 1A, the development of the cost of this solution, they're included in the original Xerox contract, the cost of the PMO, and the cost to go to the supported state-based exchange on the Medicaid side. As I spoke to earlier, that would be 90-10 funding necessary to make that change. And that is discussed in option number 3, and the dollars there are between approximately $15 and $20 million to make that change. So with that, I'd like to open it up for any questions you might have on option 1B.
Mr. Fisher, I think the only difference that I see between these two is 40 days. The cost element, the, things that Medicaid has to do are the same between the two. One would be we give ourselves 40 days to see if Xerox could do something, and the next one is that we don't give them the 40 days and give them 16 months.
Yes, thank you, Madam Chair. You are correct. You explained that very well. Yes.
Any other questions from board members to Mr. Fisher? Mr. Wildman.
Comment. I just want to make sure that we're clear on this one too, that this requires, in my mind, in all the options, so this one requires us to uncouple from the boss for enrollment year 14, so we're going to spend money uncouple from the boss and to couple with the federal supported effort, and then a year later uncouple from the federal government and recouple with Xerox. So there's some complexities there. So it's doing uncoupling and recoupling, then you got to decouple and recouple. That's the process. Right?
Thank you, Mr.
Plan year 14, we are not using Xerox. We are using the federal the FFM. And then for plan year 15, the theory is Xerox has had enough time to fix it. And then we recouple the eligibility engine back with Xerox.
Thank you, Mr. Weldon, for that explanation. That is correct. We would decouple from the boss, go to the FFM for the next open enrollment year, and then probably somewhere around this time, a year from now, we would start the recoupling back to the boss for the open enrollment period a year from now.
Let me clarify the years, because I think you were off 1 year on it. The going to the supported exchange would be for the policy year 2015, and then coupling back with the boss would be for the policy year 2016. Yes.
Leslie Johnstone. So to be clear in what it means to couple, uncouple, and then recouple, it's a 1-year use of the modified Medicaid eligibility process. So we'd be spending 15 to 20 million of tax dollars for a functionality that we would use 1 year. 10% of which would be state general fund. Thank you.
This is getting more and more confusing to me. So what we're talking about is, from the consumer standpoint, a consumer would have to enroll on the federal system and then re-enroll on the new BOSS system. So it would involve the consumer having to re-enroll twice. Is that correct?
Yes, Dr. Ford, to answer that question, yes, that's exactly what a consumer would have to do. The consumer would have to enroll in the new federal state-supported marketplace for this upcoming enrollment period. And then again, once we decoupled or recoupled, whatever you want to call it, back to the BOSS solution for the following year, they would then again have to enroll.
Madam Chair, Lynn Atkins for the record. My understanding, though, is that if we leave everything as is, that's what the consumers are going to have to do anyway. That is a flaw, if you will, or that is the procedure in the system, that anyone who has insurance now, if we leave everything as is, for the next open enrollment period, will have to go back in and re-enroll. Is that correct?
For the record, this is Mr. Fisher. I don't know the answer to that question, but there may be.
For the record, Shauna DeRose. So the system is built so that if they want to come back in, they can say, I want to stay with this. If they don't come back in at all, it just rolls over. They can come back in and make a change. But, and not to jump ahead, in every solution, every situation that we put forth in this report, other than staying the course with Xerox, whether it's going with the transfer system or going with the feds, there would be no conversion processing. So we would, all of our enrollees would have to come back in and re-enroll, whether it's through healthcare.gov or through any new system. If they stay with Xerox, our current clients can stay our current clients and they don't have to re-enroll.
Thank you, Mr. Bruce. It was, I must have misunderstood. I thought to have the APTC credits also recalculated every year, people are going to have to go, they have to come back. You can't just not do anything, but that, again, I misunderstood.
Part of the process, when you're filling out your application currently, they give us permission, and they can choose the number of years, up to 5 years. I give you permission up to 5 years to do my redetermination, and so that we can reach out, we can go back to the hub, we can do their redetermination, and send them that letter during that open enrollment period. And if they choose to do nothing, they continue to roll over, or they can come back in and make that change at that time. But they're not required to come back in and re-enroll.
This is Dr. Jameson. Can you hear me?
Yes, Dr. Yes.
So I always thought of redetermination as essentially a re-enrollment because their eligibility and everything's reviewed. But is it just thematics, or it's really not? Kind of like if you were outside in a private insurance, we still re-enroll every year. Do you know what I mean?
For the record, Shauna DeRose, Dr. Jameson, I think it's very similar to what happens in the current marketplace. We would run the redetermination within the system. They would get a letter that says, we've run your redetermination. There may have been changes. There may not have been changes. If you choose to act, you can do this, this, or this. You know, a person may have options at that time, or they can choose to do nothing, and their current situation would just roll forward to the next plan year.
Mr. Roos, I know in the ideal world this is the way it's supposed to happen, but has anyone tested it to see if it's working?
So I will say this, we haven't got to a redetermination period yet. When last we're looking at what we absolutely had to have to go live on October 1st, redeterminations was not one of those things. So it was one of the things that kind of got pushed off, and you've heard the term fast follow over the last few months. So that was one of those things. Redetermination is not something that we were going to need until October. So it has been something that obviously has been taking a backseat to QLEs and other things that we had to do right now. So the testing period for redeterminations would have been over the summer period so that we would have been ready for that in October.
You know, and another thing, I think there's some confusion because we've had brokers come and testify in front of us that they have to, for the next enrollment year, they have to start at square one again and move forward. So I think maybe that's where you're getting so many questions from board members. Can we have Xerox come forward and make their presentation, please? And if you'll identify yourself for the record, but remember to really speak into the mic so that people in the room and those that are coming in on teleconference can hear you.
For the record, this is Daniel Green with Xerox State Healthcare.
This is Rick Daston with Xerox Services Chief Engineer.
Your presentation is a PowerPoint that's on the website. It's been out there since yesterday noon. I know the board members have all had a chance to look through it. So why don't you take a few minutes and give us the highlights of it and let board members ask questions on what you're presenting, please.
For the record, again, Daniel Green. Yes, I've enjoyed the opportunity for some continuity and some detail in front of the board, and actually as recently as the Board of Examiners past Tuesday. The document that we posted is our integrated master schedule, a summary of our integrated master schedule. And it is, we've discussed major components of that schedule in this forum, as well as I mentioned recently, the Board of Examiners. This particular detail document was actually sent to the exchange early yesterday morning. It's an almost 2,000-line integrated master schedule. The document that's posted under public comment, I think it's public comment number 3 on the website, is a summarization of that schedule, as well as a deeper dive, if you will, on 5 specific focus areas that have been more recent discussion topics in the Board of Examiners as well as this board meeting. We look forward to the opportunity for a detailed walkthrough with the exchange of, if necessary, all 2,000 lines, and as necessary, adding to that 2,000 line. What I can say in terms of a summary is I feel confident that we've outlined the milestones, the plan, and we have the team for the day-to-day, and welcome any opportunity to define some of those CMS milestones as need be, as well as leading to the renewal and redetermination and open enrollment processes. And I can provide a little bit of a walkthrough as necessary to questions on that renewal, redetermination, and open enrollment process for what is intended mechanically in the BOSS operation as needed.
Again, for the record, I'm Rick Daston. My role inside of Xerox is known as the Chief Development Engineer. It's an assignment that Ursula Burns, our CEO, gave to me shortly after she met with the governor. And she wanted to make sure that we had the highest level of engineering being applied to the Nevada HIX solution set. Previous to that, I was running all product engineering for Xerox. And so it's made it clear that our corporation is very much focused on making this successful for all of you. And then since late February, early March, I've been deep embedded in the planning and the solutioning of what remains to be done. And so I think I feel quite good about the plan that we put together. And I think part of the questions that all of you will have, I'm sure, as a board, are we doing anything materially different that we should expect a different outcome? I think the answer to that question is yes. And I know that's something that would need to be proven by all of you, but I think it starts with, we have a system that the core of it actually is pretty stable. Obviously, we have a system that needs to be improved, and there's defects and outcomes that are not perfect relative to what we targeted. But we have a solution that the core is stable. It's up 99.8% of the time. We have a call center operation that works very well. So when I look as an engineer, I look at the core is, do we have a good core in this system? And based on looking at it over the last few months, I would say the answer is yes. So then the question is, well, what are we going to do different to make sure that you can have confidence in all of us? So what we did is we basically got our heads together in a very deep way, listened to all the feedback from the Deloitte report, all of the customers of yours, the Nevadans, and we're very sensitive to all of that trouble that's been created and all the issues that have been brought forward. So we digested all of that because this is a very personal thing, we understand. And so by doing that, we put together 3 things that we think are materially different than what you've heard before. Number 1 is the program plan itself. We've reoriented our solution from defect fixing. We've been talking a lot about defects over the past year with all of you, to what we call is an outcome-based model. This is an approach that we've used with other deliveries before, and what that means is we've taken 43 different outcomes that are important to all of you, like on the billing side or the financial systems or enrollments. We've tagged that to accountable owners, that there's a person identified for that particular outcome. That person will not rest or go to sleep until that outcome is achieved. And I think that's an important part. And then we realigned our plan so that the software release schedule can deliver those particular outcomes. So we have 4 releases that you'll see in the plan. I believe it's on slide 10. And those 4 releases are ending the special enrollment towards the end of May. We have our financial services, EDIs, the 820s, the part that Mr. Green is very knowledgeable about, getting all those outcomes exactly correct, because there's been lots of concerns with that. And that release happens in July end or July middle, which maybe we could align to the June 30th date that was mentioned. So there's some alignment that we can talk about there. The 3rd release happens, which is APTC and making sure all of our invoices are correct. You can see that on the plan. Release 3 towards August. And then release 4 is the redetermination renewal piece that was talked about earlier to make sure that's fully functional. And then, of course, we have the open enrollment. So what we've done is I think we have a really comprehensive plan. We have clear ownership on who owns what deliverable. We're not going to be talking about defects and defect management. We're going to be talking about delivering the capability of the system that all of you need. So that's material difference number 1, and it's appropriate for this stage of the program. Number 2 is the program management, the PMO. There was a lot of feedback from the Deloitte report, which was appropriate, about the PMO function needing to be strengthened. And we've done that. We've hired an outside third party that's very reputable. It's something that I offer to all of you, that if you want to talk with them and partner with us with them. It's a group that has done an excellent job for us so far, and they're the ones that have helped us put this plan together that you see. I've also added resources from my product world that we're adding to that to make sure we have expertise within inside of Xerox. That's our best program managers, as well as adding together with the people that are from the third party. So I think we have a really strong program management office now, and I think if that got assessed, I think you'd be pretty pleased with what we have. And the third part that's materially different is the governance model. I think there were weaknesses there as well that we needed to get it at the right level. So now the governance model is being executed at the executive level. So I am on that governance board together with our CIO for all of Xerox, called Steve Little, his name is. And we meet every day now. And so this is our number 1 priority. Again, our CEO has made that very clear. And so we meet every day with the Nevada SSHIX team. We remove any barriers on resources, on alignment, on any trouble that that team might have with also our third parties. And so that's actually working very effectively. So if we take those 3 things, I think they're materially different. Our plan aligns well, the 2,000 line plan that Mr. Green talked about. And I think it's really a situation now that we've peeled the onion, I call it. Another way we talk about it internally is draining the swamp. We've been working on this a while. I know there's been difficulties. But in complex projects like this, actually the longer you work on them, actually the better it can get. Because when you drain the swamp, you get rid of the top line problems, you peel back the onion, you can actually see where the core root cause of the problems are. So we see them now, where before they were a little hidden because of maybe how many defects that were out in the system. Now it's very manageable. The problem isn't defects, it's now the core of the piece that's stable. Now we see where I call them the alligators lie, where we can go after and solve those very specific problems. Our teams are aligned to it, and we have a program management office and a governance model that will make sure it will happen. So I believe those things are materially different that can generate confidence in what we're doing, and we're very open right now to share that plan, which we have given it to you, but go over it in detail with whoever you see is appropriate. And we do think that this is the least risk option that you have going forward. And as always, we're committed. As you know, we always have been, but I think also now we brought additional competence to the table that wasn't there before, that I think the outcome will be positive for all of you. Thank you.
Madam Chair, Lynn Atkins for the record. I believe your fourth set of Xerox that have sat were your number one priority, and things are going to be different. With the board and with Xerox that Xerox did just not have any sense of urgency about the problems that were facing Nevada HealthLink and Nevada Insureds. And in February, we were told by another set of executives that there would be a fully was proud of by the end of open enrollment. That was the date they gave us, by the end, March 30th. Happen. We were then told in March sometime, I cannot recall if it was middle of April or end of April, in testing now. That the redetermination is in development. So I hear what you're saying. We've been hearing what you've been saying for many, many, many months now, and yet we find ourselves still in this position. So I guess my question is, why would we have any confidence in what you are testifying to today?
Rick Daston, again from Xerox. It's an excellent question. It's the one that we think about ourselves when we talk with you as well. And I would say basically two things. It does come back to our ability to see where the real issues are. As you develop these very complex software projects, a lot of the reality of what's going wrong can be hidden with lots of defects and lots of misunderstanding of how the system may work. That's typical of a software project like this. I'm sure Mr. Fisher knows that as well. And I feel at this point, after studying it, I've been on board since February, that we understand the underlying root causes. So the root cause analysis is now available. And, you make your best estimates based on the available information. And I think our available information right now is significantly higher. Second, I would say we are bringing to bear a different approach that we think will drive an outcome that is different. I think that approach is something that is appropriate for this stage of the project, given that we understand the root cause analysis, that we have the ability to solve the problems at the root level. I think prior, maybe we didn't have that. So I think it's just an evolving level of confidence. And anybody who's run a large software project, either you're spinning out of control or you're spinning into control. And I think we're at a situation now where we understand the underlying pieces of it, and we're now converging to an answer that we can deliver with more confidence because we've had more time to study the system. And so your level of error of our prediction is now much lower than it was before. That's what I'd say. Yeah.
I have a question, and I don't know which one of you might be able to answer it, with respect to open enrollment next November. Do current enrollees have to re-enroll again, or what is the accurate answer to that?
Dane Green for the record. The process is, and I'll dive into just a little bit of detail so for clarity's sake, is the first step in what I call the renewal process, which is there's a batch process, which means we run a series of jobs behind the scenes that redetermine or verify. In essence, we hit the federal hub and we return that data for all of the enrollees that are in the system. And that process is scheduled, actually, if you look at slide 10, you'll see some lead up to that, but that is part of our release 4 on this roadmap, is the necessary function. So it's a true statement those functions are not in the BOSS right now. It's a true statement that those were prioritized lower, as Sean had indicated, Mr. Roos has indicated. But the lead up to that is that we do conduct a redetermination, and we do understand that out of that there will be some people who maybe don't have the same health plan in their area. They may receive a different APTC value. They may now be Medicaid eligible or the inverse. And there'll be many people who fall into the same category, that their APTC is the same or close, or that they have access to the same plans. At that particular point, there's a notice process, and that notice process is a reach out to that particular consumer, and it says, you know, here is the redetermination of your eligibility and items of change or items of stability. These are the plans that you have now. They are or are not available for you at your particular rating area, your particular address. And if you do nothing and your current plans are available, then you are automatically re-enrolled for the calendar year 2015 policies. If you call or go back to the system or are forced to because your plan is not available to you in your rating area, then yes, you do re-enter the system and complete the process for plan shopping. Either new plans because they're not available, or you may seek a variance of a plan if you so choose. So it is an automatic process. Passive renewal, I think, is what it's called in some cases. But it is a notification process and a redetermination process that is conducted, and then we do outreach. And then if they want to do something different, they can do something different. If they want to keep the same options, then it automatically rolls for that next policy year.
Okay, and then one other question. Mr. Wilden talked about the expense side from Medicaid. If we decouple and then recouple back with the BOSS system, is there an expense on your side if we decouple and then pick it back up again?
Yeah, I don't know if we know the particulars about exactly how to decouple, but it will take some effort to make sure that design is proper. I think recoupling depends on how the data exchange needs to go, right, Dan? So I think we'll have to get into the details exactly how that works, but it will be a level of effort to, I think, reintegrate back and forth. Yes.
Do any of the other board members have questions of their thoughts?
Madam Chairman,
Chair.
this is Florence Jameson.
Go ahead, Dr. Jameson.
Yes, I know we want to do this expeditiously, and I appreciate the last explanation of redetermination, passive enrollment. Thank you very much. That was really clarifying. But I think Xerox appreciates that, even from our people who testified, that they're very skeptical. And I appreciate they have a new project manager, and I appreciate they've had insight now into their root causes of problems. But I would be so much more a believer if, in view of all this enlightenment they've achieved recently, if they could just share, as I've asked sometimes in the past, three, very briefly, because we are, on a time clock, very succinctly, three of their major root problems, and how, because of this new insight from their project manager, and by the way, the name of the project manager, on how you received the clarity on exactly how you're facing that problem and advancing in a so much more positive way and spinning into control. If not three examples, at least two and surely one, since we're on this great path and you can really see. I would really love an example so that myself and other people can truly believe that you are coming into control, because I think from testimony, people still are skeptical.
This is Daniel Green for the record. I guess the three quick responses, to be really specific. I think the first one is it has been a consistent issue with the BOSS around the APTC. In the January timeframe, and even prior to that, there were specific instances where the APTC, frankly, went missing. That's the wrong term, but it wasn't stored in the appropriate database location. I feel very confident that those issues were addressed both in February and then a more recent release in April, where the calculations are now correct rolling forward. And we initiated a process that I believe I walked through in the last board meeting for reconciliation of those prior periods, where we continue to work with the carriers on that to make sure that the consumer is appropriately whole in their invoices. So that's one, I think. Two, I think in the carrier-specific processes, one of the areas of trouble or issue, frankly, has been around the EDI 820. And as recently as a discussion last week with Governor Sandoval, there were specific days where there was a configuration problem, technical configuration problem with the financial management component. I believe that we have addressed that. That was a continuing issue that caused those, I believe it was 6 days or 7 days of EDI 820s. I believe that we have identified that root cause. I won't say that it will never, ever fail or have a particular data issue, but I feel pretty comfortable that we've got our arms around that EDI 820 process. We have some cleanup to do with the carriers. That being said, I feel comfortable about the way it works going forward. And I think if there's a specific third area is, I think as has been indicated, the QLE process. It's a fair, true statement that there have been milestones that were communicated that were not met. I feel more comfortable now that in getting our arms around all of I believe there are 18 special enrollment periods in the ACA. I feel like we have a very clear map about how the system or some of the supporting operational processes address all 18 of those special enrollment periods. I expect some will be exercised rather frequently, adding a baby adoption, things along those lines. Some of the trickier ones like returning from TRICARE, things along those lines are now effectively mapped. So I feel comfortable that we have a better command of the specifics around QLE and qualifying life events or special enrollment periods, and how we address that end to end. So the ability to assimilate it at the front end in the portal, and then the ability to transmit those data elements to the carriers to effectuate or re-effectuate or change enrollment. Those are a set of processes that on this particular plan, they are essentially release 1 and release 2 are the closeouts. We do address those now in terms of a combination of paper-based process and automated process. And I guess if I would wrap up to that, and also to address one other comment from the board, is I feel pretty confident that we're operating at a level of detail, frankly, that we haven't previously communicated with roadmaps like this and with schedules like this. And I think they hit that, and I'm happy to dive into a 4 or 5 as well, Dr. Jameson or other members of the board.
Thank you. And who's the project manager?
Well, this is Daniel Green from Xerox.
Oh, thank you.
Yeah, I think this is Rick Daston. I think the question is, who's our PMO, EY, Ernst Young?
All right, for those of you that didn't hear that, project manager is Ernst & Young. So Ms. Johnstone?
Thank you, Madam Chair. You know, when the Deloitte assessment report was submitted, none of us really had much time to look at it. And so at the time, Xerox wasn't prepared to answer the question that I asked, which was, from your standpoint, was there anything in that report that was off base or they didn't represent a fair picture? I mean, so I'd like to ask that now. It's a big piece of information that we're using to help us through this decision process. So I'd be interested in your reaction.
This is Rick Daston from Xerox again. I would say directionally we would agree with it, but maybe some of the magnitude of what they were saying would be different. So for example, the level of defects in the system was probably about half of what that report portrayed. It was accurate at one point in time, but we were working very diligently on removing the defects. So the amplitude of that was different. Also, I think we were remediating a lot of the program management and also the planning during the time that they came and did the assessment. So they weren't able to see that in flight. So my guess is if they assessed us now against the program management, the governance, the planning, which we were mid-flight, I think we would get largely a much different assessment. And also, I don't want to underplay the complexity of these types of systems. So we're used to managing, thousands of problems in these kinds of systems. It's standard for anybody. And so you can get a misconception of what the real reality of where we are because of the overwhelming report, because I think that's kind of the feeling you get. But I would say if we would have had that analysis done even 4 weeks later, I don't think you would think as intimidating, because we were mid-flight fixing a lot of those issues. And a lot of the financial outcomes were getting fixed, as Dan talked about. So I would say I don't want to dispute anything that they said. I don't think that's appropriate, but our progress has been really rapid relative to what that report has indicated.
And then one more question, Madam Chair. This is Leslie Johnstone. So I appreciate the timing is significant here, but we are continuing to hear from brokers a mixed reaction about whether the system's overall getting better or not. It's not so mixed from the carriers in the last couple of meetings, that they're not seeing it improving, but maybe backsliding some. So how would you help us put that in context, where a major partner in all of this, being the carriers, feel that this is backsliding?
So this is Daniel Green for the record. I certainly can respect at a day-to-day, data element by data element. I've had an opportunity to work directly with all of the carriers. I can understand that some of the, I'm not sure what the right word is, but the frustration is that some of the day-to-day activities are dependent upon the cleanup of some of the historical activities. If I take a very tactical example, for some of these cases where I mentioned the quote missing APTC, as we go through an active remediation for populating the appropriate places and then truing up the consumer's account, on a day-to-day basis, there's a variance spreadsheet that accompanies an EDI 820 transaction. That's frustrating. And that's based upon these historical conditions that we're cleaning up, but they will persist. And frustrating is the word I can claim it. I mean, it's probably stronger depending upon the specific carriers that you talk to or brokers. I do believe in the pattern of rolling forward as those particular items get reconciled. It'll become far more straightforward and far more consistent, relative to the federal and ANSI standards for data transmissions. I think the other element is the payment process. There's been some feedback, and we have in essence a tiger team, a SWAT team. I'm not sure what the appropriate team is on a day-to-day basis. I call it tiger team, which is we're taking that feedback, individual case by individual case, and scrubbing through each of the what I think of as an inbound channel, so the integrated voice response or the portal. And I can say that as part of that, both the engineering side of it as well as the business process side, that I believe it's more stable, and I believe that as we've gone through, we've isolated some of those root cause. That's not to say that there wasn't a struggle with one consumer. All right, by no means do I deny that. But I do feel like we have the right team in place to specifically react to any of those feedback points.
This is Rick Daston for the record again. I would say the other problem we had was pointing back to one of the weaknesses we had, which was the program management. So, for example, we went a few weeks ago 8 days without making a carrier payment, which is completely unacceptable. And what we had was a situation where we didn't have the right early warning system and notification about that really was happening. So it was happening at a too lower level. It didn't get elevated quick enough to us to remedy it. That no longer is going to happen because we have a early warning alert system that's happening daily. And so I think the strengthening of our program management function also helps with that. So it's not only fixing the system, it's how we respond to events. And in that particular case, we responded too slowly.
Let me ask a question. You're talking about payments going to the carriers and consumers being able to make payments. I'm getting feedback from the brokers that they have been working on this since last October, and many of them have not received one dollar in commission with respect to any of the people that they have enrolled. Can you give me some feedback on that? And then I'd also like some feedback on how it's going on transitioning on the billing process from the carriers and Xerox.
Sorry, I was writing. This is Dane Green for the record. I think on the first piece is I'm certainly happy to dive in and provide some specifics. It's concerning that there's a broker feedback about not receiving a dime, in essence. I do know that there's a specific issue that I believe, and I'll confirm, was addressed in the last release where there were NPN numbers or broker IDs, in essence, that are on the carrier, on the EDI 834 and the EDI 820. It was, in essence, dropping that NPN identifier, and so the carriers literally didn't know who to pay. I believe, and I will confirm after this meeting, that that was addressed in the last release. I don't have my arms around yet in the potential volume of cleanup or historical activity similar to what we're doing with APTC. But I do know that's an area of focus, and that's been an area of consistent feedback from the carriers. So I can provide a more granular update after this when I get some specifics. The second piece with regard to the transition of aggregate billing, the current roadmap has us as completing our what I had previously called the concept of operations, which with each of the carriers. Our homework as Xerox was to identify the specific points where there were maybe more level of effort or more complexity, and areas where it was, quote, easier. That plan from a Xerox perspective, I anticipate having the Xerox side of that evaluation by the end of this week, so Friday this week. And then there's going to need to be some dive-ins with the carriers about, quite literally, one, the infrastructure that's available. I think I think there was some discussion across all the carriers about the level of infrastructure changes up to acquiring an infrastructure or refinement of an infrastructure on the carrier side. That's one element of that feedback. And the second is when we say there's a very specific point where it's potentially more complex from a system side, then that's going to need to be a reaction from the carriers and, frankly, some assistance maybe in figuring out a solution to that. So I do anticipate, and I know that we're on schedule for that concept of operations. I know that we've honed in from a Xerox perspective in areas that are, I don't want to say concerning, but areas that are going to need some joint effort. And the sort of tiger team, not to sort of abuse that term, but the tiger teams will be scheduled in the early part of next week with each of the carriers to walk through our analysis and whatever analysis they have in terms of their infrastructure or their readiness.
All right, before we close it and go on to item number 2, any other questions? All right, thank you. Thank you, gentlemen. Mr. Fisher, option number 2.
Thank you, Madam Chair. For the record, Steve Fisher, Interim Director of the Silver State Health Insurance Exchange. Option number 2, this was an option that came out of the Deloitte assessment. This is to transfer an existing system, state-based system, from another state. This was outlined in the Deloitte assessment. There are currently 8 states that have developed systems that allow more people per capita than Nevada to select and enroll in a qualified health plan. Those states are Vermont, California, Rhode Island, Colorado, Connecticut, Washington, Kentucky, and New York. The process to transfer another state system would obviously require time, funding, oversight, of course, to ensure success. We would also require CMS approval from a funding perspective to move forward with this option. We have 2 sub-options within this option. One is to transfer the Connecticut system by November 15th. While Deloitte Consulting was doing their assessment, and the fact that Deloitte Consulting also was the integrator on the Medicaid side, so they built the interface between the federal hub, the eligibility engine, so on and so forth for the Affordable Care Act. While doing their assessment, they were also able to match up with another state, Connecticut system, And so Deloitte Consulting is making a recommendation that the Connecticut solution is, from a business perspective, a good match for the state of Nevada, good strategic fit. And what I mean by that is strategic fit in the sense that they would be able to stand up that state transfer system by November 15th. As stated earlier in public comment, I can't remember the gentleman's name, but he did mention that the Connecticut solution does not have standalone dental. That is true. It would not be there on day one. That would have to be something that would be placed into the system at some future point in time. The feasibility of this particular option, the exchange can expedite a contract process working with the purchasing division to transfer the Connecticut solution. As with option 1A, the transfer system would be required once again. We would have to have a contingency plan. We would have to have a plan and certain milestones that would have to be met by June 30th, which is a short period of time. If those milestones are not met by June 30th, then the option to go to the supported state-based exchange would then become an option for falling back on the fact that that transfer system, we could continue down the transfer system process, the Connecticut transfer system process, following open enrollment period if that was the decision, and if the contingency would come into play. As Mr. Wilden alluded earlier, this would require, obviously decoupling and recoupling, and so there's a lot of work there as well. The cost of transferring the Connecticut solution is approximately $67 million. Those costs include the system implementation, the hardware, the software for both the pre-production environment and the production environment, the hosting of the environments, and any additional modifications required to the Connecticut system for Nevada. And so with that, I would like to open it up for any questions you might have on a Connecticut-specific transfer.
Any questions from board members on option 2A?
Madam Chair, this is Leslie Johnstone. Initially, my question is about the cost. When we say that it is requested in the next grant application, I know we just turned one in. Is that incorporated in what was submitted just recently?
Thank you for the question, Ms. Johnstone. Yes, in an effort, in the event that this was an option that was selected, we did submit a grant request for funding from CMS. However, that grant request will not receive approval until, I think they have a certain number of days, 60 days to approve that grant request, so that full grant request wouldn't be approved in sometime in the July timeframe. We could, though, however, redirect, as I spoke to earlier, the $10 million of funds that are going to go unused. We could redirect the $10 million to get this project started for a period of time to move the project forward. So that's another option as well. And that's been a redirect. We've already turned that in as well to CMS, asking for a redirect of those funds for this purpose as well.
Okay. Would it be our intention under option 2A to also hire a project management vendor?
Yeah, under any of these options, the recommendation from the assessment was that the Silver State Health Insurance Exchange, they basically require, or they said, hey, you need more staff. You need more expertise in the area of project management. You need more expertise in the area of IT. You need more expertise to help out with some operational areas as well. So to answer your question, yes.
Thank you. And then I think my last question is regarding the milestones from CMS. Do you know if it would be the same set of milestones by June 30th under this option as if we tried to remediate our current situation?
Well, To answer that question, I mean, the Xerox, they're in probably a slightly, I guess, different spot than, say, a brand new transport system from another state, but I would imagine the milestones would be similar.
Okay, thank you. If I might, my memory of the meeting is, yes, there would be milestones to this. CMS did express some concerns on the short time frame that that we would be looking at with a November 15th go live date with a new state vendor. They had some concerns on it, but they also said if the board felt that was the best thing for Nevada, that they would, respect the board's decision. They did also talk about the $67 million. They felt that number was extremely high. And I guess my concern would be because there wasn't any competitive bidding on that, we're probably getting very high end of a proposal on this too, where if we did go to an RFP, I would expect to see that number drop.
Yeah, this is Leslie Johnstone. I am pretty concerned about that cost factor. I'd have a hard time going this way without knowing if the funding's there or not.
Any other questions from board members? All right, let's move on to option 2B. And Mr. Fisher, before you do that, I think there's a typo on this. Let's just take a quick look at it. Option 2B is transfer system by October 15th of 2015 and become a state supported. No, that's correct. We'd be the supported state-based marketplace for 2015 with the new system going in place by 2016.
For plan year 16, that's
For
correct.
plan year 16. Okay.
Which the open enrollment starts October 15th of 2015.
Okay, no.
So that is somewhat confusing.
Yeah, it is.
So option 2B is to transfer a system, the option would be to go supported state-based marketplace beginning now for the next open enrollment period with a transfer system process that we would have to go through, an RFP, as Madam Chair mentioned just previously. We would go out to RFP, we would go through a solicitation process. It takes approximately 5 to 6 months to go through that type of a process to vet out a transfer system from another state, therefore probably reducing the cost of transferring a system from another state. So this option would be supported state-based marketplace for the next open enrollment period. We would, once again, decouple, go to the Medicaid would do the work to do the decoupling and recoupling to the federal exchange for 1 year. And then after going through the RFP process, accepting a vendor and transferring a new system in from another state for the next open enrollment period, we would then again turn around and recouple to that new transfer system. The cost associated with this particular option, the cost isn't really readily available to us, as the market hasn't determined the going rate for a transfer system. I mean, we've heard from other states, Massachusetts, $122 million, Maryland, we've heard figures in the 40 to 50 million. But once again, going through the RFP process, that would vet out the actual cost of the transfer system. Current costs, we put in some estimated current costs for a transfer system based on states that I just talked about, between $40 and $70 million again. That would be vetted out through a RFP process. This option would also include the cost of option number 3, which option number 3 is going to the supported state-based marketplace, the cost that Medicaid would have to bear. So keep that in mind as well when considering option 2B. With that, I'd like to go ahead and open it up for questions.
Lynn Atkins for the record. So option 2B, consumers would go to NevadaHealthLink.com and the federal system on the in the back end or behind the scenes would do the enrollment and eligibility, but it would still be NevadaHealthLink.com. And while that transition was in place, or while that change is in place, we would also do an RFP for a potential vendor for the following open enrollment period. Is that right?
Thank you for the question. Yes, you would have a link on, say, a Nevada Health Link website that would link someone to, well, there's really, in this particular,
go ahead,
which would link someone to the federal site where they would enroll in a QHP.
So I think by link, I think what we're saying is they would definitely go to NevadaHealthLink.com, they would fill in their name, they would start that process, and it would connect to, they wouldn't know. They wouldn't know the difference. They don't go out and click a link that says healthcare.gov.
Right. So just kind of like now, you fill it out through Nevada Health Link, and you don't necessarily know who the vendor is and who's kind of doing all the computations and calculations. But for the consumer, it's still NevadaHealthLink.com.
I'm sorry, I misunderstood the question. Yes, the face of the Nevada Health Link would be there so that citizens of Nevada would feel like they're just enrolling in a Nevada Health Link website.
And then my follow-up question is, and if we did that and simultaneously did an RFP, we would not be binding ourselves now that we would want to go the route of getting another vendor. If for some reason this system partnering with the feds was working, and or if we saw bids coming in significantly high, we would still have the option of maintaining the state-supported exchange. Is that right?
Thank you for the question. Yes, this would give the exchange flexibility. You would be going down the supported state-based marketplace option first, with an option to do something different in the future. That is correct.
If I could add just one thing to that. So the last opportunity for the exchange to submit a grant request is November 15th. So if we were to go down the path of the supported state-based exchange, over the next 6 months we do the RFP process. If you decide as a board you love the supported state-based exchange model and you want to stay there, you can stay there. You absolutely have that choice. Knowing that if we pass by that November 15th, that last date, to say we've found a new vendor, we have this new process, then you're pretty much done to get that support from the federal side. And if there were any changes going forward from that point, the state would have to fund that ourselves. I will also say that, and I believe that Chair Campbell and Steve can back me up, that while the federal government said that part of the state supported model would be to include eligibility and enrollment and appeals and exemptions and everything else that they do, that at the current time they are already discussing keeping the eligibility, but turning the enrollment back over to the states. Knowing that, that would be a functionality then that we would have to take on going down the future path. And while Mike would, Mr. Wilden would already have that maybe on the Medicaid side, and we can leverage that and include it, again, just another piece that hopefully they could give us more information very soon so that we could explore that opportunity too. I just don't want to lose that November 15th time frame of an opportunity for that last grant request.
Let me ask a question about the grant request. If the board went with option 2B, and we would let out an RFP, which takes 4 to 6 months, and we get a reasonable cost on it, but they say they want 18 months to build the infrastructure and implement, is there the possibility that we could stay a supported exchange for 2 enrollment plan years, still get the grant and let that grant roll out for 18 months rather than 1 year or 6 or 7 months?
I think that you definitely heard Administrator Taverner say that she would support, what we need to do to make Nevada successful. She absolutely said that having DD&I through the entire calendar year of 2015 was very, very doable. I think that you have a question after that. If we tried to take DD&I into calendar year 16, design, development, and implementation, so building a new system. If we tried to say we needed 18 months to build a new system, we might have a little bit of a problem with that, because now you're talking about still spending that federal dollar into calendar year 2016, and our grant, even if we get the grant from the November 15th application, those funds will expire December 31st of 2015. So I would hesitate to say, it would be part of the RFP requirement that they would be ready by October 15th of 2015, which would be the open enrollment of the following year. And again, if we're talking right now, option 2A, that Deloitte could come in with the Connecticut system and be ready now for November 15th, if we go the next 6 months and we do an RFP, now you're literally giving them somebody 12 months. So you're giving them twice as much time in order to do the same thing, and hopefully for half the cost. So I think the opportunity is there for that.
Mr. Weldon?
Thank you, Madam Chair. Mike Weldon for the record. I just again want to voice, I don't know if it's concern or just comment. Under 1B, we're uncoupling with Xerox, we're coupling with the feds, and we're recoupling with Xerox. This one adds more risk to me because we're going to uncouple from Xerox, couple with the FFM, and then recouple with an unknown vendor, an unknown state system.
Mr. Weldon,
And have the 2 rebuilds on the Medicaid side and 2 90-10 funding cycles.
I think, though, the qualifier on this is that we would go to a successful state exchange, one that's already up and functioning, that would have actually gone through 2 enrollment periods already. So I'm not sure.
I understand that.
Maybe unknown vendor to Nevada.
Unknown vendor to Nevada. That we have a working relationship on the, I'm talking on the Medicaid eligibility engine side with Deloitte now. So in an RFP, you don't know who the winning vendor is. You don't know what that vendor, what state they're going to bring to you. On the Medicaid side, we're recoupling all along the line. It's new dance partners every year, potentially.
Well, I would hope that Deloitte, if we issued an RFP, would come forward and bid in that process. And hopefully, given the fact that they would have 2 enrollment years using the Connecticut system, if that's the best one, a lot of the flaws would be dropping out of it. So, and with that, hopefully the cost would be significantly lower.
I would agree. With more time, you're going to drive down the potential cost for the RFP. Absolutely.
Any other questions on option 2B?
Marie Kerr, would the issue an RFP necessarily mandate issuing an RFP as to the entire set of as the entire functionality that Deloitte and that Deloitte does, such that we could issue an RFP that would leave intact the portion that's working, I guess is what I'm trying to get at. Can we do that? Do we have to do it? Is it an all or nothing proposition with issuing a new RFP? Can we only issue an RFP as to those portions which are not functional? If it's working, it would seem to me that it would not make sense to cease that operation. Is that possible?
Ms. Kerr, I guess it could. I guess my question would be, who's going to ascertain what part's functional?
I don't know the answer to that question. I think if we can say, Medicaid is working, without trying to say, parts A, B, and C that we don't know are working, but we can identify one particular part that is working. Medicaid's working. Why would we change what's working? Now, I do not support any situation where we continue with non-functional
operations that have been non-functional for, quite frankly, way too long.
No,
So
Ms. Kerr,
I guess I'm asking
I don't think
if you could only, okay.
I don't think
ahead.
we're looking to change anything in Medicaid. It would be just, is Medicaid linking to the BOSS system, or would Medicaid link to the federal marketplace in a supportive position? So I would agree with you. We don't want to touch Medicaid. It's working fine. It's just who we connect with. Medicaid currently connects with the BOSS system. These decisions would say, Medicaid, we would like you to decouple from Xerox and link up with the federal marketplace in a supported position.
Okay.
Madam Chair, this is Leslie Johnstone. I actually have several questions, if we have time. I wanted to start with the RFP process. Not to second guess what the ultimate rules are for this, but it strikes me that we have, I don't know if there are 4 or 5 vendors that are in these successful states that we want to talk with most closely. And so would it be more expeditious and maybe even smarter shopping if we look at how other states put in successful systems and then decide which of those models work best for Nevada, as opposed to potentially carrying some requirements from the previous RFP that maybe made it more difficult for us than it needed to be. So just kind of thinking fresh about successful operations and take that approach first and then decide what so you get the functional requirements in your mind and then decide how the procurement process needs to proceed.
Thank you for that question, and certainly Shauna can fill in where I fill in the gaps. There is a process called an RFI, Request for Information. We can certainly go through that process where you request those vendors that you just spoke about that have been successful in other states to come in and do presentations on the systems that they have built in other states. And we, the state of Nevada, would obviously entertain that, listen to what they have to say, look at the system, do a really good analysis of each of those systems. However, we would still have to go through some sort of a procurement process in order to procure one of those vendors, and that procurement process is an RFP process, which is you can't preclude other vendors from being part of that RFP process, if that makes sense. So I don't know.
If I can jump in. So this is Shauna for the record. Absolutely, I don't think it was the intention of the staff to say that we would use the same RFP that we used last time. We've learned a lot in the last 2 years. So absolutely, we would be looking for the right functionality, if the board wanted to go forward and say that it would be a requirement to have the standalone dental. It would be a requirement to do certain things with Medicaid. Absolutely, that new functionality would be in the RFP. And again, with the time frame, just using Deloitte as an example, the current system doesn't have the standalone dental. If they say that they can go out and next summer, they could have that. So if they were to respond to an RFP now, they could show that part of the process of the build next year, they would have standalone dental. So we would very much work with the board, purchasing, EATS, our federal partners, and looking at all those other states to see all the lessons learned to create an RFP that would give us the best possible procurement. Does that answer your question?
It does. I just think that as one board member, I really want to find out how other entities made it work before we decide or reconfirm what our requirements are, so that we don't repeat any of our past mistakes as a board even. And then my other set of questions, and this is because I don't really appreciate this state-supported marketplace structure. I was wondering if we could go stakeholder group by stakeholder group and talk a little bit about what they would see. So if I break it down, plan certification, does that operate the same way under a state-supported federal marketplace as it would under the state-based marketplace?
So plan certification is one of the functions that would remain under the purview of the state. The exchange has currently, we're partnering with the Division of Insurance, and they are going through that plan certification process as part of their rate review process. So they would still do that. The difference would be is as the plans are certified, instead of being loaded into the state-based exchange, it would be loaded into that federal marketplace.
Okay.
But the actual certification would remain in the state.
Okay, thank you. And then the next group were the consumers. You know, John Smith shows up and he doesn't know if he's Medicaid or non-Medicaid. Does he go to the Nevada Health link and it sends him? How would it work if he was one or the other?
So one of the big differences in healthcare.gov versus Nevada is that they have two. You would go into the system right now, you go through, you enter your entire application, and it gives you the screen with the check marks and the X's that say you're eligible for this program or that program. Because the federal government utilizes a application that's separate for the two, they ask a couple of screening questions, and then it helps point you to the direction that it goes.
What does it look like to the consumer? Do they get
It'll
sent
look
to a different
very,
system? Or?
It'll look very, very similar to what we have now because it has the Nevada Health Link screen. It's purple. It's, you know, it's the same front page that we have now. On the back end, we're connecting to healthcare.gov, and they start asking all of their questions. Now, you're right. It's not going to be the purple screen on the backside because it's just healthcare.gov for all the states. So it won't look like ours. The exact questions that we have here in our state won't be asked because they are slightly different on healthcare.gov because in Nevada we have, I think we did a gap analysis, we have about 11 questions that we ask that the federal government does not ask. Now those questions are in our system for the convenience of our Medicaid program so that they are gathering that additional information. Our Medicaid staff have indicated that they can do without those questions while we're going through this process. It just means that they may have to reach out to a client and gather that information to do a final determination of their eligibility and actually get them enrolled in the program. And Mike, you can jump in there.
If I could jump just real quick, I think it would behoove the state of Nevada not to create an entry point for the citizens of Nevada where they could put in a certain set of information that would then determine whether they go down the Medicaid path or they go over to the supported exchange. That's something that we can design as part of the go forward if this was an option that was selected. We have to make all sorts of modifications on the Medicaid side anyways. There's a lot of work that needs to be done over there. We have to make modifications to their online application so that they can accept Medicaid applications electronically. So we could put a face on that and a kind of a, you might call it a predetermination that folks would walk through, and we would then determine which path they would go down. We would simplify the path for those coming into the system. That's just an idea, but that would have to be obviously talked about and designed and so on and so forth. And then I can turn it over to Mr. Wilden. I'm sure he has some ideas as well.
Mike Wilden for the record. You know, I think one of the things that we'd be interested in from the Health and Human Services side, and I forgot which one of the feds used this language, but I liked it. It's the sort of better front door messaging. And so that's a problem we've had is when people don't know they go to Nevada Health Link and then they spawn and whatever, and then they come over to welfare, and we ended up with 68,000 backlogged applications that we're working through. With better front door messaging, you know you're going to be a Medicaid eligible, then it's a direct connect. The questions that Shauna talked about, the 11 questions are generically, they're about helping determine is it an aged, blind, disabled, is it people with activities of daily living deficiencies, things like that, and so better front door messaging, you don't need to have people go to the health link, federal or state, and say, oops, you really should have gone through the Medicaid front door and then get transferred over. So better front door messaging, I think, is really important going forward so they don't spin and take longer time. So that'd be my suggestion going forward with this discussion issue. And then I had one question. I just want to make sure when we're doing an RFP down the road, is it an option or a possibility? So I'm still a little confused with the feds do eligibility and enrollment. And I don't get the discussion, but the feds may uncouple enrollment, or the states may have some liability or responsibility. I'm not sure what the right word is there. And if in the RFP, do you have to ask for, can you separate out the enrollment piece and just RFP to get a vendor in to do enrollment and stay with the feds for eligibility and decrease the cost of the RFP?
I think the indication that we got from the feds was that that was something they're looking at. It's something that they don't have fully fleshed out yet, which is unfortunate for us because we're trying to plan what we're doing over the next few years and we don't have all of the information. Absolutely, we can always ask, because you can ask for separate pricing in response to an RFP for different pieces. One of the things that we did during the RFP last time that I think one of the lessons learned, from Ms. Johnstone, was we got a flat price, and we are not able to uncouple easily some of the different pieces. So we could always get pricing for different pieces of it so that we would know which direction we could go.
One of the concerns that I came away with after listening to them vetting out whether or not that they want the states to take on the enrollment process is, it's the risk benefit as you start to make this decision. If we decided not to issue an RFP for a new vendor, and 18 months down the line, the feds decided that the state should take on the responsibility of enrollment, I think that pushes that cost then to the state and to the state general fund. And I know that there's been a clear message that the exchange needs to be self-supporting and not relying on general fund dollars. So now you look at the per member per month fee, and can it absorb that additional cost should it occur? If you go with another vendor that has the enrollment capability and the eligibility, then that risk goes away if the cost is competitive.
Madam Chair, I'm still not clear about which system is doing what. Is under this scenario, is healthcare.gov doing all of the eligibility determination, both for APTC as well as Medicaid?
Thank you for the question. No, they're only doing the QHP eligibility.
Okay.
For individual and shop. APTC as well, yes.
Okay. And so that's what needs to be rebuilt at DWSS? So it is, and they may or may not be Medicaid eligible.
I'm not on. The answer is we hope they're going to be Medicaid eligible, that they're predetermined to be Medicaid eligible, but sometimes when we do income verification and things like that, they're not, or we've seen what I would call shopping to make myself eligible, where people will put income limits in, and so they'll look to be Medicaid eligible, and then when we verify they are not Medicaid eligible, so they get denied, and then they get sent back to the Nevada Health Link to make a decision to purchase or not purchase a QHP.
And under this model, healthcare.gov would still be doing the predetermination in order to know which records to send over to welfare? And
yes,
then,
I believe so.
And then if it's found to not be Medicaid, they would be sent back to healthcare.gov, which would look like Nevada Health Link. But then healthcare.gov or Nevada Health Link would now know that they're truly not Medicaid, and so to not send them back to welfare. Correct? Okay.
That is correct.
Then brokers. What would be the big change for brokers and navigators? How would things look different to them?
So a couple things on that. I'm sorry. Training. So starting with the EEF side of the house, so assisters or navigators, that is one thing that would stay in the purview of the state. We would still have our program for navigators and assisters. We would have to train them. We'd have to bring everybody back in, broker or navigator, train them on the new system, how it works, the questions that get asked. I think one of the big differences for brokers is what we call direct enrollment. Of the 4 carriers that we currently have, 2 are domestic carriers, so they're just here in Nevada. The other 2 are across the nation. And in that instance, a broker could go in, say, to, I'm going to just use, for instance, their Anthem portal, because they are appointed with Anthem. And they would start the process. They would go out to Nevada Health Link, which would go to healthcare.gov. They could determine the eligibility, get the APTC calculation, and that information could come back, and they could actually go enroll that person directly with that information in their portal on the Anthem website. So they have the ability for a direct enrollment. Now, we do not have that ability for those domestic carriers that we have here in Nevada. So the Co-op and St. Mary's would not have that particular functionality for the brokers who are trying to sell those plans. The navigators would still help people through the process. We just have to retrain them. And it's very similar to what they do for a client now as they walk a person through that application. So again, we would have now when it comes down to, I'll say this, I don't know what it looks like. I haven't been out to healthcare.gov to see if there's a broker portal similar to what we tried to do early on. I would have to find out more information about that. We could bring that back to the board to tell you exactly what that looks like, maybe some screenshots. But I think there's some different functionality there. And it would certainly require, if you all remember back last September, when we put 1,500 people through training in that month, to get everybody kind of ready to go to do this, we would have to do that again. We would have to put everybody back through because it's a whole new system for them. So it would require a tremendous amount of training on behalf of our helpers. And, necessarily, I think at the last board meeting, I think Ms. Ellis came forward and said, this is a monumental thing, and all the ways that we know the system and we know how to use it, they would just have to learn that again and be able to streamline how they get people enrolled.
Let me ask the board a question. Going on 11:15. How many people are going to have to leave fairly soon, and what time? I just need to know, because I don't want to disrupt this discussion.
It's Dr. Ford. I have to leave at noon.
At noon. Okay. About noontime. Okay. Ms. Kerr?
I'm available.
Okay.
Davidson here. I'm available still.
Okay. All right. So I don't want to disrupt this. If people need to take a quick break while we're talking, please go ahead and do that. But we'll keep moving on here. And about 11:45, we'll figure out how far along we are in this process. So, all right. Do we have any other questions at 2B? Yes. Ms. Johnstone.
Thank you. The navigator and assister certification, would that remain with the state?
If I could defer that to Mr. Kipper from the Division of Insurance. I know they do certification through the Division of Insurance.
Thank you, Mr. Fisher. For the record, Scott Kipper, and it is my understanding that would not change. That the process for certifying those individuals would be continue to be transparent as it is today. That process would not change.
Okay, thank you. Regarding the call center, how would one know if they should call the welfare call center or the Nevada Health Link call center, which would be healthcare call center? How would they know which one to call?
So again, I think that the question on if we do a better job of determining that pre-eligibility and telling people it appears that you're eligible for Medicaid, Nevada would be required to keep a number, an 800 number. And that would be a Nevada number that would direct also to healthcare.gov. And then also Nevada, part of Mr. Wilden's requirements and all the changes that welfare and supportive services would have to make is that they would have to make a lot of changes in their call center and being able to, currently they don't take applications over the phone. They would have to start doing that. That's never been, my understanding is you've never done that before. So I think that there's, the call center is another area where there would be a huge shift in functionality. And I want to address the question also on the call center staff, because we would be hooked up to the federal call center. And we did ask the question while we were in DC, what about the law regarding certification of the of those call center staff, because they are enrolling people in a Nevada product. And that was the one area where they actually kind of pulled back a little bit and said, we can't require the federal call center employees to become certified under Nevada law, you know, to enroll people. And Glenn Shippey was there on behalf of the Division of Insurance, and he said that he would work with Commissioner Kipper and get back with the feds and that they could work that out. So I will say that that part of it also, we do have some questions surrounding yet.
So, Commissioner Kipper, do you have any reaction to that at this point?
No additional comments, although I know, again, for the record, Scott Kipper, and I appreciate Shauna's, Mr. Roos's comments there. And we certainly intend to follow up with CMS to make sure that anybody that's dealing with a Nevada consumer is fully educated and fully in line with Nevada requirements as much as possible. That was the intent of the entire Navigator program initially, that they be as educated and accountable, and we want to make sure that that continues.
Thank you. So as far as the front door messaging, I appreciate that could never, you know, it can always be better. But what if somebody misses that? Will welfare be able to tell where the person is if they're over in healthcare.gov or in their system, and healthcare.gov be able to tell that they've been sent to welfare? What would that look like? Do we know?
To answer your question, at least based on the little bit of knowledge I know and the discussions we had on Thursday, what they do with other states is what's called three-way calling. So, for example, if a Medicaid recipient had a person on the phone, they could also get a person from the call center from the federal side. A Medicaid person does not have access or would not have access to the federal system. They would have access to what I would call a three-way call, where they would be talking with a federal call center person, the Medicaid call center person, and then obviously the member on the phone. And they could obviously work through that process that way. That was one of the discussion points we had on Thursday, because we brought that up with the call center between, you know, what happens if you have the situation that you just brought up, right? And so that was what they do with other states.
And then would brokers be able to assist in any of that? Or how would the broker be able to assist their accounts, their customers?
You mean through the call center? Yeah, they would be able to call the call center.
And be part of the three-way?
Be part of that three-way
okay.
Discussion as well, yes.
Okay. And then I don't know if anybody knows this last question. I know by most media accounts, healthcare.gov is working much better. Do we know what is not working yet on healthcare.gov, where it's still having problems? It doesn't, the EDIs aren't quite a spreadsheet anymore, are they?
I talked, there was a gentleman there who was overseeing the IT side of it. He was brought in to help with the healthcare.gov. He did not mention to me that they were having any major issues with the system. So I wasn't made aware of any major issues with the system. Not to say that there aren't. I just don't know any specific issues. They weren't brought up. I mean, I asked the question if he was having any major issues, and he didn't speak of any.
The one area, if I may, that where they stated that there would probably be a real difference for the board is in reporting. That healthcare.gov does not go to the level of reporting that you're used to getting. You wouldn't be able to see Nevada-specific reporting for all of those wonderful charts that Laura, puts together for your board meetings. They don't break down their reporting that way. They certainly don't break it down weekly. They have a monthly report that they give. We, Nevada, would still be responsible for some reporting back to the feds for certain items, Medicaid obviously going forward, but they would not be able to, they don't certainly now come back out with some of the race and age statistics and things like that you have asked for and that we've been providing regularly. You would not be able to get that information.
If I might be able to add one thing, I do think with cooperation from our carriers, they can provide that, and then we could summarize it, if they're willing to give that type of information back to the exchange. So I think there's more than one avenue to get some reporting that would give comfort to the board on how the enrollment process is going.
And then how would they manage Nevada? Would we be like a customer account where we'd have a contact person at healthcare.gov for us to work with consumer issues that make their way to the board?
So currently we have our federal state officer, Gustavo Senos, and he is the one that currently, when somebody reaches out to our federal office or our federal partner, he actually is the go-between for that, and we report back to him on those issues. So I absolutely think that if it's not him, it would be another person, and we would have daily interaction with them, because even though they're doing the appeals and the exemptions and things like that, we would have to be involved very, very deeply. And they did indicate that if you go down this particular path, the trips to DC would be much more frequent. So I think we'd be involved.
Any other questions on option 2B before we move on to 3? All right. Mr. Fisher, option number 3.
Sure. Thank you, Madam Chair. Option 3 would be to utilize the federal infrastructure supported. We would start off as, say, a supported state-based marketplace and stay on that state-based marketplace indefinitely. And as Shauna alluded to earlier, there may be, the feds may make a decision down the road to turn enrollment over to the states at some point in the future. But as Shauna alluded to, they're in early discussions around that. The exchange may choose, much like Oregon is proposing, so Oregon is going down this particular path. And during the meeting with CMS, they obviously indicated that that this is an option and that they would support this going forward. If this was a decision of the board to stay on a supported state-based marketplace indefinitely, that they would support that as well.
Madam Chair, Lynn Atkins. So if I'm right then in just comparing the two, it sounds like, and Mr. Wilden, I don't want to speak for you, but this would be a easier plan for your department in the sense that you would just be kind of making a change once and there wouldn't be another potential change down the road. Is that kind of the big difference here?
Thank you, Mike Wilden, for the record. Yes, this would be a one uncouple from the boss and one couple with the FFM, Federal Marketplace.
Madam Chair, I have one last question. I think it's the last question. Under the state-supported or supported state-based marketplace, what would we do with the per member per month fee that we are assessing on the carriers?
Obviously, that was my number one concern when we were there. I was very happy to hear that because we would maintain our designation as a state-based exchange, and technically the supported is an internal term that they use, we would still be a state-based exchange. And so under the Affordable Care Act, the per member per month would come to the state. So the $13 that the board has already voted on for next year, even if the federal government takes over the eligibility and enrollment and appeals and exemptions and the EDI process and all of that, we would keep the $13 per member per month. We could use that for operations for our staff. If we have to go out and hire our auditors, things like that, we would use it for our assisters, navigators. We would use it for training. So there are definitely the things that we would use that money for, but it would certainly be a lot different than, you know, currently you think about we would get that $13 per member per month, and you would have to pay, you know, right now $5.80 out to Xerox in the contract per member per month. Right now, if we went this path, we would keep that whole $13.
So the federal government would not be charging us to use their system?
There would be no charge.
Okay. Is it too late for us to consider what that fee is if we don't have the expense?
It is currently too late for the next calendar year to change that fee.
Lynn Atkins, for the record, that was my same question, and I guess even though you just answered it, so we can't go downward from that. It's too late to go downward from that fee, Mr.
So I am not an attorney, but I would say that our regulation states that we will make that fee during 8 months out, and so the carriers can utilize that and include that into the rating schedule that they have to put together and determine and get it to the Division of Insurance for plan certification for the year. We could ask our DAG to weigh in on that, but I think that our rates are set for the year.
So if that, Lynn Atkins, for the record, so if that was the case, though, we would be able potentially to significantly reduce the rates the following calendar year, understanding we would have a reserve, and therefore that would be a benefit to consumers in a significant per member per month drop in the following calendar year.
Absolutely, yes.
If I might, Mr. Kipper, would you weigh in on this conversation?
I'd be glad to. And I think Mr. Roos, well, first of all, for the record, Scott Kipper, and I think Mr. Roos laid that out very succinctly. And that is our understanding as well on the per member per month fee would be given to the state by the feds, and that we would be able to access the healthcare.gov for no cost. And that would be, is my understanding, that PMPM is not changeable until sometime in the future when the board has that window, the time to make those changes.
Okay, I just wanted your confirmation that we couldn't change the per member per month fee at this time in this current year.
Madam Chair, for the record, Scott Kipper, and I believe Mr. Belcourt could probably confirm that, but according to the regulations, my understanding that that PMPM figure has been set.
Dennis Belcourt, Deputy Attorney General, for the record. The board has a lot of flexibility in changing its regulations. You're not governed by 233B, which sets a window of, usually about 90 days to get a regulation amendment. So the real driving factor in whether you can change the rates should be how that affects the process of rate setting by the insurance. And so if it can still be done in congruent with what the needs of insurance are, then the board could agendize a change in the regulations, as pretty quickly.
So I guess my question to Mr. Kipper is, how disruptive would that be in the process of setting rates right now?
Madam Chair, for the record, Scott Kipper, and I would say that we probably needed to be done, 2 months ago. As carriers are starting to develop those rates, it is also my understanding that if the board considers going to a supported state-based marketplace system, that the timelines that the Division of Insurance has set for submission of rates and forms will be accelerated by a measure of about 3 weeks. So it would be if the division, if the board chooses to revisit that regulation and has the desire to change that per member per month fee, it would have to be done post haste in order to get those fees built into the structure for open enrollment starting on November 15th.
Thank you, Commissioner. I guess there's just one other comment that I want to bring out on option number 3, if there aren't any other questions, and that again is the likelihood of the feds making the states take on the enrollment process. If that were to happen, and we didn't have a vendor selected that could do it, we run into a real cost factor that if the understanding with the legislature and the governor's office is that they do not want any general fund dollars coming over to the exchange to support it, we'll have to try and figure out how that 10 to 40, whatever, $40 million figure is going to be.
In the interest of full disclosure, Senators, for the record again, while we were here, I actually sent an email to Jennifer Stolbach and asked her, what is the likelihood of that happening? And her quote back is, oh my goodness, all one word, no idea, but not in the near term. So while they stated it when we were at the meeting, I think it's one of those thoughts that's running around out there, but there's no real meat to it at this point. So I think if the feds have been always very good, if you're, excuse me, they change the rules on you, they help you. They help you recover from that. And so I think there would be additional, I would hope there would be additional funding opportunities at that point. So, but not in the near term was her quote on that.
All right, any further questions on option 3? All right, hearing none, let's move on to option 4. Mr. Fisher?
Thank you, Madam Chair. For the record, Steve Fisher. Option 4 is to recommend to the Nevada legislature that Nevada officially become a federally facilitated marketplace. Nevada has the opportunity to return to the exchange functionality completely to the federal government to be designated as an FFM. This option would require a bill draft request to the legislature recommending the disbandment of the exchange and repealing of NRS 695I, all control and functionality with exception of the Medicaid CHIP side of it, plan certification, rate review would revert to the feds under this particular option. But once again, that would require a bill draft and a legislative decision on that. Feasibility, in order to activate this option, the Nevada legislature would need to approve it during the next legislative session. Therefore, this option would not provide short-term relief, and the board would need to pursue the FFM infrastructure or continue ahead with Xerox during the interim to ensure Nevada continued to meet the ACA requirements. The cost, if we were to go to the FFM, would be the cost very similar to the cost of going to a supported state-based exchange. All of that work would be required on the Medicaid side to connect to the federal exchange. And so with that, I'd certainly open up for any questions you might have.
I would have a question for you, Mr. Fisher, and that is because the legislature doesn't start or convene until February 2015, and our open enrollment starts November 2014, and we still have to do something for the enrollment year 2015. I think anything that would happen in the legislature would be prospective and impact us at 2016. Is that your understanding as well?
Yes, thank you, Madam Chair. That is my understanding, yes.
Do we have any questions or comments from other board members on option number 4? Okay. It is 25 of 12. I'm going to ask the board if you feel like you have enough information right now to discuss and deliberate this, or would you like, we've called for a special meeting on Friday just in case people don't have enough time to digest all this information, and I just want to ask how the board feels at this point in time. I want to give you the opportunity of restudying this again if you want to, or moving ahead if that's the choice of the board.
Madam Chair, Lynn Atkins for the record. I don't know what different information we would have by Friday. I think this is just a long time in the making. I think staff has laid out these options very clearly. I think there's been great discussion. I think we've talked about most of these options in some form or another over the past couple of months. So I would encourage us to move forward with discussion and have a vote on one of the options.
All right. Any other comments from other board members?
I would agree with, this is Dr. Ford, I would agree with Vice Chair Atkins.
Okay.
I agree. This is Florence Jameson. I agree.
All right. Ms. Kerr?
I agree as well.
All right. Thank you. Then we will proceed. All right. Let's open it up for discussion.
Lynn Atkins for the record, I'll start. I'm just kind of utilizing the front page of the report as an outline for purposes of discussion. It would seem to me that option 4, going to the federal exchange, is not a real option right now, that we cannot do that. So I would suggest that just be taken off the table for purposes of discussion. Under option 1, 1A, where there is a June 20th deadline for remediation plan and benchmarks by our current vendor, Xerox, I haven't heard anything or seen anything that makes me believe that we're going to make that, and that we're just kind of kicking the can down the road another 40 days. So I don't see how that's an option. 1B, going off Xerox for a year to a state-supported plan, and then committing ourselves to going back to Xerox. I have no appetite for that at all. I don't think that is a smart move for the board. I don't think that's a smart move for Nevada. Option 2A is very expensive. That's the taking the exchange in a box, I guess, as we've kind of been describing it. I think if we had more time and we knew about the cost a little bit better, I think that might be workable, because it seems that there are other exchanges out there besides healthcare.gov that are working. And so again, time and money, I think, is against us on 2A. I would say 2B and 3 to me are the two options that are really up for debate here. That's kind of how I see it. 2B, I think, gives us a little more flexibility. It doesn't commit us to leaving the state-based exchange and going to another vendor. It at least gives us the opportunity to set out an RFP and see what our options are, see what could be done, see how the state-based exchange with the federal government is working. Option 3 does that, but again, doesn't give us the flexibility. Obviously, the cost on 2B and 3 is, something I think very good for the state and good for consumers. I agree with a lot of what Ms. Johnstone said. I mean, I think there is no perfect solution. I think there's going to be challenges to any of these options. And even if we do focus the discussion on 2B and 3, I don't want the consumers having to go back in and reapply either. There's a lot of things that aren't perfect, but the current system is intolerable and is not the best we can do. So I would suggest that the discussion focus on 2B and 3, and those are my thoughts.
Do we have any other comments on board members on starting the discussion in that manner?
Marie Kerr, I agree with you, Lynn. I do not think that options 1 or 4 are viable. We've seen so many broken promises from Xerox about how they're going to fix it that it becomes at some point not credible that their system can be fixed within any amount of time that would work for the state. And option 4 we can't do. And so, and 2A, I just think that the expense associated with that, I don't think the state has the funds to do that unless we have the grant, which we don't have a guarantee of. So thus, definitely, we should focus our discussions as suggested by Ms. Atkins.
Dr. Jameson?
I would agree. As nice as 2A is, we don't have the funds.
All right, Ms. Lewis?
I would agree also. I think that our options are fairly within the ones that have been reviewed here, that our options are fairly limited in terms of option 2B and option 3. And I think that my only concern about option 2B is would a longer period of time to actually implement with a new contractor. But I would certainly think that our options are between option 2B and option 3.
Mr. Fisher, if you would join me on this. On option 2B, we have gone through that with CMS, and we have enough time and have the possibility of having a grant approved for us once we go through a competitive bidding process. And at least our conversation with CMS at that point in time was having that vendor ready for the 2016 enrollment year.
Yes, thank you for the question, Madam Chair. As Mr. Roos stated earlier, November 15th is the last opportunity to ask for funding to support something like that. So therefore, if we were to go down a path of doing an RFI to kind of figure out which might be the right, time is once again not on our side with regards to this option as well, being that it takes approximately 5 to 6 months to go through an RFP process. That takes us right up to November 15th. So we would have to start today on an RFP process to make the November 15th deadline in order to have a dollar amount to then request from us to move forward with this option. So,
is there an expedited RFP process?
I think, for the record, Shauna DeRose, so when we did the RFP process last year, we tried to do it as quickly as possible. We only had the RFP out on the street for, we planned for a month. We pushed it to 6 weeks because we got so many requests for extra time. We had more questions than had ever been received before by the purchasing division on an RFP in the state of Nevada. I think that, I know we hate this word. My opinion is that we need to be careful on trying to expedite it so much that we make those same mistakes going forward. And I think that we do have the time to do a thorough and thoughtful process on an RFP and still get to the October or November BOE and give that vendor, just about a full year to do this process. And a full year to do a process on something that we're hearing could be done in 6 months or less, I would hope. I'd like to make one more comment because I've heard several of the board members say we don't have the money to do option 2A. So I want to remind the board that we put in a grant request that included the funding for option 2A. And I would be remiss if I didn't say to you that if the board chooses to go down that path, I think that while CMS may say, hey, we want you to go talk to Deloitte and possibly bring that cost down or do certain things, I think that the message from Ms. Tavener was very much that we have less time than we have than money. So, and we've already turned in that grant application. So I didn't want you to think that it is a no because we don't have that money. So part of my job is to tell you that we're not closed out from that option because of that reason. I think time, again, is, the concern from our federal partners was you just don't have enough time to go down that path and be ready with Deloitte for November 15th, not that we didn't have the money.
Madam Chair, this is Leslie Johnstone. I would echo most of the comments of the other board members regarding option one. It's the track record is just not there to change the confidence level in either one of those approaches. As far as transferring from another system, option 2A, for me, it is the unknown of the money, and it is just a strong sense that that price is just too high. And if we go through a competitive shopping process with an RFP, we will get a much better dollar value. And then 2B seems like the natural step to 3 to try 2B before we decide to ultimately go to option 3 if that's what we decide to do. It just seems like we're cutting off our choices if we go immediately to option 3. And option 4, in terms of going to a federally facilitated marketplace, I think there will be action taken with or without us if our decisions don't play out better in the next open enrollment cycle. So that'll probably take care of itself.
I also would support that we go with option 2B just because of having more options within it. At the end of the day, if the pricing doesn't come in at a competitive level and the board does not feel good about it, there's nothing mandating us to move with a new vendor. But if we go to 3, we've eliminated taking a look at it and being knowledgeable about what's out there.
Levon Lewis, for the record, I would certainly agree with the chairman's comments. I think that option 2B gives us more options in order to be able to consider a new vendor while being on the federal exchange. And then if that doesn't work out, we can always just stay there.
This is Dr. Ford. I just want to weigh in. I agree. I would be in support of 2B, but I think I would also I would need a lot of convincing that the RFP process would yield a result that's better than the facilitated process, and it would be worth the Mr. Wilden's point is well taken, that it would be a lot of work for him to couple again. And I would need a lot of convincing that option 3 would not be the best option. So I think I would agree to 2B, but I would need a lot of convincing not to be on the option 3 boat.
Lynn Atkins, I'm ready to make a motion.
Madam Chair, if I could, before Ms. Atkins moves, I'd just like to weigh in on behalf of the Division of Insurance and say I do appreciate all of the comments that have been made, and we at the division would certainly support option 2B, which is to be a supported state-based marketplace. Looking at this from a consumer's standpoint, the consumer protections that are built in that we have at the Division of Insurance would remain. That is the rate oversight and the qualified health plan certification, as well as the Navigator program that this group has jointly put together. I would not like to see any of that go away, and I think 2B provides the best option for the Nevada consumers as well as for the board.
I'm sorry, just one more question. In terms of option 2B and the federal government not charging us to use their system, was there any idea that that was a one-year arrangement and that after that there would be a fee?
For the record, Shauna DeRose, no. As long as we are a state-based exchange, the Affordable Care Act requires that we collect the PMPM and we hold it within the state. So that would not change after any period of time. There currently is no charge. There was no discussion of a charge to utilize those services because we are a state-based exchange. And again, the public-facing name is a state-based exchange. The supported state-based exchange was definitely an internal name that they were using to kind of differentiate it, but they said for all intents and purposes, we are a state-based exchange.
Madam Chair, after reviewing the options identified by staff and finding that the current Nevada exchange functionality provided by Xerox State Healthcare LLC has not met the goals established by the board, nor is there confidence that the current system will function to expectations at the next open enrollment period. Understanding that staff has secured conditional support from the Federal Center for Medicaid Services to help Nevada with additional resources to move the exchange to a system that will provide better functionality, I move that the board adopt option 2B for the next open enrollment period, which begins on November 15th, 2014, and in furtherance thereof, that the board direct legal counsel and staff to end the business relationship with Xerox State Healthcare LLC as expeditiously as possible by mutual agreement or otherwise in accordance with the contract, and that legal counsel and staff report back to the board at our next regularly scheduled meeting.
Just before we get a second on that, I want everyone to know that next scheduled meeting is June 12th. So is there a second to that motion?
This is Leslie Johnstone. I'll second.
All right. There's a second, a motion and a second on the floor. Is there any further discussion? Hearing none. I'd like to take a roll call vote on that, Mr. Fisher, if you would help me with that, please.
Sure, Madam Chair. Ms. Johnstone?
Aye.
Ms. Lewis?
Aye.
Dr. Jameson?
Dr. Jameson here. Aye.
Ms. Kerr? Ms. Kerr?
I'm here, yes.
How do you vote, Ms. Kerr?
I'm sorry, I repeated it 3 times. Aye.
Thank you.
Dr. Ford?
Aye.
Vice Chair Atkins?
Aye.
And Madam Chair Campbell?
Aye.
That's unanimous.
All right, we have a unanimous vote to support option number 2, and staff and council have direction on what the wishes of the board are. We have another item on the agenda. We'll close agenda item number 3 and move on to agenda item number 4, which is a verbal report from council.
Agenda item 4 concerns the litigation that's currently pending in the 8th Judicial District. There are 2 options that I'm put before you for approval. There are things you can do concurrently, which is one, to tender the defense and request indemnity in the event that there is any liability in that on the part of the state, the exchange, in that litigation, to Xerox through the contractual indemnity provision of the contract with Xerox. The other is to invoke insurance coverage under the insurance policies that were obtained pursuant to that contract. The request here is to obtain the board's authorization for those 2 actions to be taken. The necessary paperwork needs to be done to do that, so we don't have anything final for you to approve. It's just merely to get your authorization for staff and legal counsel to make those demands pursuant to the contract.
Do we have any questions of board members to Mr. Belcourt? If there are none, then we need the board to authorize that indemnification to be prepared, and we would have Mr. Fisher sign that on behalf of the board.
It could be either Mr. Fisher or myself.
Okay.
We'll work it out.
Okay. Is there a motion to approve?
Madam Chair, Lamont, for the record. I move that we authorize staff to prepare the required documents necessary to proceed with the whatever we were saying earlier. Yeah.
All right. Is there a second on the telephone?
Dr. Jameson here. I second that motion for them to indemnify.
Thank you. All those in favor of the motion?
Aye.
Aye.
Aye. All right, that sounds like it's got a unanimous approval on that too. So let's go to agenda item number 5, which is discussion of possible action for future board meetings. And again, as stated, we did do a placeholder meeting for Friday, this Friday, in case we didn't conclude business today. Does staff or council see any reason why we need to continue with that meeting, or shall we just let everybody digest some things today and come back tomorrow and call me and let me know whether or not we should have that meeting or not?
For the record, Madam Chair, we don't have an agenda out there for Friday.
Oh, so we don't have a meeting then.
Unfortunately, we missed that, and
okay.
we wouldn't be able to have a meeting for Friday.
That becomes a moot point then. All right. Our next scheduled meeting then is Thursday, June 12th.
Madam Chair, this is Leslie Johnstone. I think I heard that we could talk more about the PMPM assessment for the calendar year 2015, and I think we owe the carriers and the policyholders that discussion.
Lynn Atkins, I agree.
Any other suggested topics for agendas? Mr. Wilden? No. Mr. Kipper, anything that you feel we need to discuss at next meeting?
Madam Chair, nothing at this time.
Okay. How about Ms. Kerr and Dr. Jameson? Okay, Dr. Ford, anything for you? And I would like staff to update us on the RFP process, since we will be moving down that path. I would also like to know a little bit about the review of the proposals when they come in. I really want to make sure, I know the state has its statutory requirements on what's done, but I really want to make sure that we have enough project managers on that review team and people that have had experience bringing up new systems so that we get really good input on looking at a potential vendor, and also really good referrals on everyone that decides to make a proposal.
And Madam Chair, I would hope that we would also have a really good review of the references for the proposers.
Madam Chair, this is Leslie Johnstone. I would strongly recommend, if the staff can afford the time, that they do some site visits to states that are considered successful, talk to the customers, and get to look at those systems before we do anything, so that we know better about what is working out there, and not just rely on what the vendors tell us.
Madam Chair, Lynn Atkins, and probably an update on the executive director search.
All right, we'll close agenda item number 5 and move on to public comment. Do we have anyone here in Henderson? Please come forward. Oh, okay. Sorry.
Madam Chair, I just wanted to report that the lady that had the comment under public comment at the beginning of the eligibility issue, staff have resolved that issue. So.
Great. Thank you. Thank you, Mr. Wilden. I appreciate your help on that. All right, and if anybody wants to speak in Carson City, could they come to the testimony table and we'll jump up there in a few minutes?
Dwight Mazzoni, for the record, I'm a producer. I'd like to respectfully request that the agenda for the June 12th meeting include from exchange staff an item that deals with because we'll be on a federal exchange, deals with the training for navigators, assisters, CACs, and also the producers, because I believe there will be a much different process that everybody's going to have to go through to be able to sell on the federal exchange, and how that might be best effectuated. I don't think just having the exchange do a training program for the people in Nevada is going to work. I think we're going to have to do an online federal exchange training program.
All right, and you may be correct on that. We heard little bits of it when we were back there, but we'll get more information to everyone so that everyone has forward-looking knowledge. You might as well keep it on. I think somebody else is going to come forward. Thank you. If you please come forward.
Patrick Casal and Associates. I would like to ask or request that the board would hold Xerox accountable for the outstanding issues that are prevalent as you're making this transition, because there's a numerous amount of people right now hanging out there by a string trying to get into the system, and we're trying to get that done. They have an obligation. They took a contract, and they should fulfill that part of the obligation through the end of the SEP. That's my request.
Thank you. Any other comments? How about in Carson City?
Doesn't appear so, Madam Chair.
No others here. All right. Thank you, everyone. I appreciate your time and patience. Thank you, staff, for working so hard on this for the last week. And we will adjourn, and we will see everyone Thursday, June 12th.